In my past life, I was a surgical genius, known in the industry as the Divine Physician. With today's interview, I'll definitely land the job.
I'm very sorry.
So what if I'm a Divine Physician? Now that I've traveled here, I can't even find work. And this body has appendicitis.
Sir? Are you all right, sir? 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 I'm sorry, but our lead surgeon has collapsed from exhaustion. But we will send a better, more professional doctor to perform your surgery.
Can you hurry up? The anesthesia is already wearing off. Others get a cheat code when they travel, so why do I only get appendicitis?
Great physician system. Experience 0. Abilities none. Daily check-in. Not performed. Task list. 1 task pending.
System bro might be late, but it's finally here. My cheat code. It's finally arrived.
Does the host wish to check in?
Check in.
Location factor is 0. No reward bonus. Random reward obtained. Master level purse string suture technique.
A basic reward. Gives me mastery over fine tissue suturing. That's 10 years of skill. Accept the novice task.
Congratulations, host. Novice task accepted. Requirements. Perform your own appendectomy. Rewards. 1 novice gift pack. And 1 master level appendectomy technique. Main quest. Once the host becomes a doctor and reaches associate director, you can unlock hidden surgical fields.
Hidden surgical fields? Could it be the surgical forbidden zone, the brainstem? I can't even pass a hospital interview. And you want me to be a director? Isn't that just a pipe dream?
There was a major crash on Dongxing Road. The hospital has no available doctors left. I've requested instructions, but you'll have to wait a bit longer.
If no one is going to do it, then I'll do it myself.
Don't cause trouble. Oh my god. This incision. It's absolutely perfect.
Got a mirror? Hold it up for me.
Yes, right away.
Nurse Liu, the surgical department sent me over. What am I seeing? The patient is operating on himself.
Don't just stand there. Help me.
Yes, sir.
A massive car crash. It's a brutal scene. It's terrifying. Where is he? He just had his appendix removed. How could he leave his bed?
The hospital is short-staffed. Even the interns are being called into action. If I join in, maybe I can save a life or two. I have a medical license, so in an emergency like this, it's not against the rules. If I do well, I might even get a job here. What's the patient's condition?
Major crash trauma with massive bleeding. Pressure has been applied as an emergency measure.
What are the pulse rate and pulse pressure?
Pulse rate is 137 per minute. His blood pressure is 70/50, with a difference of 20.
This is a typical shock patient. If we don't start resuscitation immediately, he could be gone at any moment. Quickly, to the ER.
Random quest triggered. Quest requirement. Major car accident rescue. Quest rewards. Based on protocol rating, success rate, and number of people saved, generous rewards will be granted. During the random quest, experience points earned will be doubled.
Faster! 2,000 milliliters of Ringer's lactate. Low molecular weight dextran. 200 milligrams every 10 minutes. Rapidly inject midazolam.
He's actually awake.
Prep the OR immediately. Prepare for surgery.
Resuscitation rating. S grade. 1 person rescued.
Xu Qiu? No way. He just finished surgery. How can he be in the ER? Hello? Right, okay. It really is Xu Qiu. Not only can he perform his own appendectomy, but right after surgery, he's already jumping around everywhere.
Why is Xu Qiu here? Leaving that aside, he failed the interview. Didn't this guy just finish his appendectomy? Xu Qiu.
President He.
Those stitches are perfect. I didn't expect Wang Fan to be so skilled.
I stitched them myself.
You did it yourself?
Dr. Xu, the patient is stable. He's saved.
Good.
This attending doctor is the best in the ER, yet one rescue made this arrogant surgeon completely admire Xu Qiu. You came right after, finishing surgery?
Yes.
How many rescues have you joined?
7. And all patients were saved.
No wonder there wasn't much pressure this time. Turns out an expert like Xu Qiu handled 7 critical cases, all by himself. Dr. Xu, yesterday, I was wrong about you. Representing the hospital, I'm hiring you as our doctor. Looking forward to working together.
This highly skilled doctor, who took control of the room, was actually rejected yesterday.
President He. Let's work well together.
President He really performed surgery on himself, then rushed to save others. Right after his own operation, he saved 10 people total. How could someone like this be rejected by our hospital?
I won't say more. Just watch the video.
He detected via blind search the ectopic appendix. His knowledge of anatomy is terrifyingly precise.
This surgery is like a work of art. This footage definitely has the potential to be a teaching video.
Impressive work, Dr. Xu. Welcome to Linhai Hospital Emergency Department.
Dr. Xu, your skills are so refined that I couldn't even help much. I'm embarrassed.
No worries. Without you, I wouldn't have had the chance to operate.
So, Dr. Xu, shall we take the night shift together tonight?
Shift? What shift? Shu Qiu just finished surgery. He needs several days of rest.
True.
After his own appendectomy, with his abdominal stitches still in, he still wouldn't leave the patient. Such ethical doctors, nowadays, are becoming increasingly rare. Go back to your room first. Once you're recovered, you can start working.
Dr. Shu, the word about you rescuing someone right after your own surgery has spread everywhere. You're a celebrity now. Many young women are fighting to book your appointments. These abs. And the wound are recovering quite well. The medical department, the uniform and badge are all ready. Whenever you're healed, you can start.
All right. Nurse Liu. Even a loose nurse uniform can't hide her incredible figure. Time for today's check-in. The mission from 3 days ago, with its success rate of 100%, granted a rare high-difficulty skill. Master-level lower limb reconstruction. Checking in for today.
Check-in location. Impact factor 1.3. Small reward boost applied. Random reward obtained. Perfect level manual hemostasis.
Perfect level manual hemostasis. This is my first perfect level reward. But manual hemostasis has long been abandoned by time. The only place it works is during out-of-hospital first aid. Perfect level manual hemostasis. It actually surpasses modern technology. I can use my sense of touch to locate bleeding points and easily stop bleeding that otherwise can't be found. This makes me a human blood stop machine. Are you ready?
I'm ready.
Dr. Shu, would you mind if your girlfriend had a scar on her stomach?
Don't worry. I'll do my best with the stitches. There won't be a wound after surgery.
You really are Linhai Hospital's star doctor. So skilled and so gentle.
Let's begin. Was the anesthesia not enough?
I'm a bit excited.
Is this girl some kind of masochist? Opening the abdomen. Hemostatic forceps. Surgery complete.
The surgery is over. Time taken 10 minutes and 21 seconds. Dr. Zhu, you set a new record for our ER appendectomies. This flawless technique, was Shuqiu really rejected by several other hospitals? At this level, I'm not even worthy to carry Shuqiu's bags. As an attending physician, I can't give Shuqiu, a mere resident, any more grunt work. I'm lucky just to be his assistant.
That car accident. A director's daughter has a severe leg fracture. The hospital is contacting bone reconstruction specialists for a reattachment consult. I need to get over there and check things out.
Congratulations on completing an acute appendectomy. Grade. Sit rank. You have gained 30 experience points. You have earned an extra 3% toward master level.
Appendectomy proficiency. Once it hits 100%, will I automatically advance to perfect level appendectomy? My experience is now at 90%. One more surgery, and I can enter the lucky draw. I wonder what kind of reward I'll get.
After much debate, the best approach right now is still amputation.
Can't we reattach her leg?
The golden window for reattachment is 6 to 8 hours. Moreover, the limb must be in very good condition. But for your daughter's leg, it's definitely impossible to reattach.
Director Chen, we've already 3D printed a titanium prosthesis. I wonder if Expert Lin has any way to help?
Expert Lin, can my daughter get a prosthesis?
The risks are very high.
Very high?
Director Chen, you're one of us, so I'll be blunt. Titanium reconstruction, in this country, isn't a mature technology yet. She's been waiting too long. The outlook is grim. As for reconstruction now, the success rate, well, there's no precedent here. We must amputate.
Lin Xie is an industry giant in orthopedics, especially lower limb surgery. He's top tier. If he says it's impossible, then for King of Hell, it's already over. My daughter.
No. There's still a chance for reconstruction.
What nonsense are you talking? Expert Lin said it won't work. Who are you to say? There's still a chance?
Ridiculous. Do you even know what orthopedics is?
President He. The professionalism of your young doctors really needs to improve. Xiaoxuan. My daughter, what's wrong?
Rapid, thin pulse. Her body is cold. Pulse is slowing down. It's signs of shock. She's losing too much blood. Your daughter's toes are losing blood flow. The only option now is removal.
What?
Director Chen, there were chances before, but now that necrosis has started, restructuring the femur is impossible.
I won't be able to dance anymore. He said he can rebuild bone. Dad, let him do it.
Making my daughter face such tragedy is already cruel enough. That doctor will only end up causing her a second trauma.
The bleeding won't stop, and we can't find the source.
I'll do it. Small-town hospitals are truly pathetic. The director's level is a joke. This is the perfect time for me to shine. The wound area is severely damaged. I don't blame you for failing to stop it. You couldn't stop it? If the blood won't stop, amputate now. It's not just about her leg anymore. If we don't take it off now, to stop the flow for good, your daughter will be gone.
No more waiting. I have to push through no matter what. Perfect grade manual hemostasis.
You scumbag.
Blood pressure is stable.
What?
Expert Lin, don't touch him.
Dad, I want him to perform the surgery.
I don't know how this young doc managed to stop the bleeding with his bare hands, but stopping a bleed and bone reconstruction aren't even on the same difficulty level. It's not impossible. I could consider the bone reconstruction, but if it fails, I'll amputate immediately. In that case, the incision will be larger and the surgical fee will be even more expensive.
Daughter.
Fine. I'm willing to take that risk. Dr. Xu, will I be okay? Can I still dance?
Just get some sleep. Whenever you perform next, I'll be there to watch you.
I will dance well and wait for you to come and see me.
Full anesthesia is complete. The prosthesis has been delivered. We're ready to start at any time.
Start the surgery. He stopped the bleeding, using only his hands. How on earth did he do that? It's too unreal. Whatever. He probably just got lucky. But only I can perform this ultra-complex prosthesis reconstruction in this entire country. The patient wanted Xu Chu to do it. How could I ever agree? Now that she's under, I have to take over to increase the success rate. You actually know how to do this surgery? Shu Qiu is assisting so well, he hasn't blocked my field of vision at all. Even the directors, who have worked with me for years, can't match this coordination. Shu Qiu's control over the rhythm is equal to mine, or perhaps even better. Have you performed bone reconstruction before?
I can handle it. I've actually mastered bone reconstruction. In the entire world, there are very few people who have reached master level. Watching your movements, I think you look a bit like an amateur.
The preoperative estimate was 13 centimeters, but things are worse now. We must remove at least 19 centimeters. With such a massive excision, amputation is a safer bet. The posterior tibial artery? How can it be here?
The patient waited too long for treatment. The tibial artery has retracted into the leg bone. Several segments of it are completely buried in the tissue.
If that's the case, it can't be reconstructed. We have to amputate. Give up on reconstruction.
Professor Lin, may I try one last time?
You?
I only need 5 minutes.
5 minutes, huh? Fine, I'll give you 5 minutes. 5 minutes won't hurt anyway. Worst case scenario, we still amputate. Let's see this unpredictable young man show his skills.
Like this. Yes, just like that. Keep it steady.
Success.
Not bad.
As a top expert, I'm being praised by a resident in his 20s, and even taught how to stop bleeding.
A doctor like this in the ER is truly a waste of talent.
They have a genius like him, yet they cry poverty to us, and still try to take our staff.
I really had no idea.
Actually, Shu Qiu was specially recruited by me.
The top expert I specifically invited is acting as the assistant, while a resident is the lead surgeon. Expert Lin, you all.
Director Chen, he's doing better than I can. Quiet down for a moment. Don't interfere with our notes.
These jerks. Did they wait until I was away to decide that if the patient is gone, the resident would take the fall? Get out of the way. Such fluid surgery, even though I'm an outsider. I can tell this young man has real talent.
Director Chen, listen, if you're done here, could you please move?
Be quiet. Don't distract Dr. Shu.
Director Chen is just an outsider. Don't let him keep that prime spot and waste our chance to learn.
The toes are warming up. The blood flow is restored.
Dr. Shu's stitching technique is absolutely incredible. That leg looks exactly like it did before.
It really does.
Surgery's over. Take the patient out.
Young man, to be so young, yet so experienced, you're truly impressive. You'll surely be a world-renowned specialist one day.
Providing the patient with the best medical solution is what we doctors do.
Here. Take this. It's my card. Keep it.
This is Director Chen's private card. With one surgery, Dr. Shu just reached the top.
I'm going to see my daughter.
Dr. Shu, we're currently tackling some forbidden zones in bone reconstruction. If you're interested, join our research team. You can name your own budget.
Lin Xie, how dare you poach my staff? Right in front of me.
I'm not poaching. I just appreciate talent.
Have you considered leading your own sub-department for bone reconstruction?
No thank you, Director. I want to stay in emergency. Master-level bone reconstruction technique is only the start of my medical career. In the ER, I can see every type of patient.
If that's what you want, then stay in emergency and tell me if there's anything at all you're not happy with.
Dr. Shu, young genius. You should visit our department sometime.
Outsiders are fighting over him, and now you are too? Dr. Shu already said he wants to stay in ER.
President, directors, I need to check the surgery reports, so I'll head out first.
Go ahead.
Congratulations on completing a 3D printed cervical spine titanium alloy reconstruction. S-rank surgery rating. Congratulations. You gained ×50 experience. You obtained master bone reconstruction, plus 3% proficiency. You may draw a prize.
Draw.
Drawing in progress. Congratulations, you obtained master finger dexterity.
Master finger dexterity? Before, I only dared to cut small blood vessels in fingers, but now my hands can reach into the brain, moving between nerve fibers and brain matter without any shaking. This ability is insane.
You know Lin Xie, right? The top expert in bone reconstruction. However, it's not him I'm hyping today. It's our very own Dr. Shu. Surgeries even expert Lin can't do, our Dr. Shu can.
Who in the hospital hasn't heard? I heard that patient, 3 days after surgery, had leg function tests better than patients recovering for 2 weeks. I also heard he was a new recruit this year and was almost rejected during the interview. Thankfully, our vice president has an eye for talent.
Dr. Shu was almost rejected? Then what kind of genius was better than him? They must have been promoted straight to director or something.
I'm the doctor who was hired from that same interview. Direct hire? What promotion? Forget being the lead surgeon. Even getting into the O. R depends on the mood of the nurses and attending doctors. How can the gap between people be this wide?
About that Dr. Shu from ER, have you heard? Don't be so discouraged. As an undergrad, you co-authored 2 SCI papers and trained at Johns Hopkins. Your potential is higher than his. Besides, we in neurosurgery can do ER work, but can an ER guy come to neurosurgery? One wrong cut would scramble the brain.
All right, Director. I'll get back to redressing wounds.
How about this? This afternoon, I have a surgery. You follow me and gain some experience.
Yes. Thank you for the opportunity, Director.
Fine. Let's go.
Dr. Shu, I'm here to handle the discharge.
You can go to the nurse's station directly. I've already signed the certificate.
I just wanted to say goodbye in person. Look, Dr. Shu. Dr. Shu, thank you so much. My wound has been itching and hurting, but thinking of you kept me going. Dr. Shu, can I get your WeChat?
Everyone, we have a tricky patient here. Come and help me out.
Isn't this a clear case of a herniated disc? Wang Fan, have you forgotten everything you've learned?
Exactly. Send him straight to spinal surgery. It's nothing complicated.
The patient is 21. Isn't a herniated disc a bit early for his age? Plus, his lower limbs are almost paralyzed.
What?
Dr. Shu. Well then, I won't disturb you anymore.
The patient is too young. That herniated disc must have another cause. Does he have a history of spinal trauma?
Yes. The patient said he was racing cars 7 or 8 years ago and had a traffic accident. He broke 2 cervical vertebrae.
And this x-ray? The angle is too low. We should take it higher, to include the whole spine.
Fine. I'll check again.
If I'm right, the leg paralysis is related to those vertebrae. I've earned a lot of rewards from these recent check-ins. Expert-level nasal hemangioma removal and master-level interocutaneous fistula repair. One more draw gave me master-level intramedullary tumor resection. If it really is a spinal cord issue, then his life is already halfway saved.
Incredible. Simply incredible. Dr. Shu, the film was just 1 vertebra short from showing the lesion, and yet, we still missed it.
That is exactly what happened. Dr. Shu, this is truly a terrifying clinical intuition.
Dr. Wang. Dr. Wang. Is it a tumor? Does my son have a tumor? Please, you must save him. Our family only has this one boy.
Dr. Shu, this is the patient. Yue Hongliang. He's only 21 years old.
Dr. Shu, I beg of you, please save my only son.
Please get up. Stand up first, all right?
Get up. Please get up.
A spinal tumor like this is the specialty of spinal surgery and neurosurgery. You can ask Shu Chu to save his life. But when it comes to removing the spinal tumor, he will surely be helpless.
Basically, it's confirmed to be a tumor. Get an MRI. And also, perform a lumbar puncture biopsy to determine the tumor type.
Thank you, doctor. Thank you so much.
Dr. Shu, should we transfer the patient to neurosurgery?
No need. Let's check the type and grade of the tumor first.
Understood.
The tumor is benign, but the location is tricky. It happens to be connected to the brainstem, which pushes the surgery risk to the maximum level. Hello?
Is this the ER?
Yes.
Radiology called at noon, about a patient with a high-level spinal cord ependymoma.
Yes.
Our director reviewed the scans, and we discussed it during lunch. The tumor location is very difficult, and the surgical risk is extreme. We recommend conservative treatment. That way, the patient might at least live a bit longer.
Okay. Even with my master-level skill in spinal tumor resection, operating near the brainstem is like playing with fire in a fireworks factory. You heard them. And I also recommend conservative treatment.
So, doctor, will this affect having kids?
Right now, the tumor is not pressing on the reproductive nerves, so it won't affect his fertility.
Doctor, I want the surgery. I can't be a cripple. I can't be a cripple.
Liang Liang, listen to your mother. The doctor said, the risk is very high. This thing won't grow any larger anyway. At worst, we can live without that leg. From now on, your sister can just take care of you.
Mom, I can't trouble. I can't trouble my sister. I can't be a burden to her. Mom, I can't be a burden to her.
Don't move around too much. If the tumor shifts, I can't guarantee which nerves it might compress.
Okay. Liang Liang, Mom promises you. We won't do the surgery. Mom promises you.
Shu Chu. This. You can actually do it?
I can.
I thought a resident in his 20s doing bone reconstruction was impressive enough. Now he says he can do a spinal resection. Even I can't pull off this surgery. If you're really sure, I'll vouch for you. But I have to call a neurosurgery direct to supervise.
No problem. Is he waiting for the end? Or did he already predict the surgery would succeed?
Director Zhao, is the emergency department calling you for a consultation?
They have a patient who needs surgery. It should be related to our neurosurgery department. They want me to oversee it. What? Not interested? I heard the lead surgeon is that supposed miracle worker, Dr. Xu.
Dr. Xu.
Let's go. Haven't you been traumatized by him? Today, I'll show you that neurosurgery is one of the most advanced departments in the hospital. The fact that you were chosen proves you're no worse than that, Dr. Xu.
Thank you, Director Zhao.
Let's move.
Let's start the surgery.
Under the microscope at 8 times magnification, Xu Chu's hand is perfectly still. Such rock-steady technique. Is this a level a resident can reach?
This is a C4 to C6 tumor. Performing spinal tumor resection.
Dr. Xu opened the spinal dura, and from the back side, made a perfect midline incision. He completely exposed the tumor in one move. Flawless timing.
Steady. So steady. He didn't even touch the fragile surrounding tissue. The suction work is superb, too. Perfect precision. Not a single bit of residue left behind.
Weren't we here to find faults?
Xiaoshen, look, don't try to copy his methods.
Great! Finally found a flaw.
His surgical style is way too risky. If you copy him, without having his skill, you're just leading the patient to their end.
This is what he calls finding faults? But what the deputy chief said is actually true.
Learn from him, and the patient is ruined. If you're only similar to him, the family might make you pay with your life. I've never seen talent like this before. It's a tumor with an associated cyst. The cyst's fluid is spraying everywhere. This is bad. This is a spinal cord tumor. During a resection surgery, accidents are inevitable. Even with the best skills, nothing can be done. The surgical field is blocked. There's no chance to continue. Dr. Xu, stop the dissection. Otherwise, it will cause even more severe spinal damage.
Director, he's still dissecting.
By visual observation. Wait, this is microsurgery.
Resection successful.
How did he do it? He performed surgery with almost zero visibility.
My previous thoughts were far too narrow. Xu Qiu is an ER doctor, but he is a natural at neurosurgery. He's a genius. Someone like him, in the future, could even challenge the brainstem, the no-go zone.
Doctor, is my son.
Don't worry. The surgery went smoothly.
That's wonderful. Thank you, Doctor. Thank you so much.
Director Zhao, what are you doing here?
I'm here for that surgery log. Dr. Xu, I was wondering if that log is still useful to you. If not, do you think you could give it to me? I'd like to take it to neurosurgery as a teaching case.
No problem. It's yours.
Thank you. Thank you. Dr. Xu, going forward, whenever you're free, feel free to visit neurosurgery. If you have time, you could even join our teaching conferences.
No problem. I'll be there if I can.
Great. Then I'll head out now.
Okay. Take care.
Will do.
Come visit my office sometime. Dr. Xu, you're amazing. That Director Zhao is famous in this hospital for being so arrogant. You actually got him to come here to ask you for a log. Incredible. You're just incredible.
Stop it.
Dr. Xu, someone from public relations is looking for you, and they say there's good news.
Good news? What kind of news, do you know?
I heard it has something to do with Chen Mengxuan in the VIP ward.
A donation?
You guessed it. It is a donation. This money, on the surface, is for the emergency department, but everyone knows. The reason Director Chen donated is entirely because of the surgery you performed.
Director Chen.
Dr. Xu. In our emergency department, we have many talents like Dr. Xu who have given so much to our citizens and people. The reason I am donating this time is because of the emergency doctor's dedication and care. President He, I hope our department can train more talents like Dr. Xu.
Director Chen, this is just a doctor's duty.
Excellent. A true hero, shown at a young age.
Hello?
Is this Dr. Xu?
Speaking.
I'm from Human Resources. I tried calling your cell, but the line was busy, so I'm calling your department's landline.
Since I left the meeting, several department heads have been reaching out, so my phone hasn't stopped ringing. Is something wrong?
Well, we just received notice that the hospital decided to adjust your salary level. It's being raised to the $500,000 tier. Detailed information will be sent to your phone shortly. If you have any questions, feel free to contact us.
Understood. $500,000 a year. I don't have to worry about rent now. I should be finally settled in Linhai City now. Time for my daily check-in.
Daily check-in, complete at Linhai Hospital. Impact factor is 3.6. Check-in reward. Medium boost applied. You have received master level vascular palpation experience.
Vascular palpation? There's a master level for that? At this hospital. With this. Am I not a human ultrasound machine?
This is a severe pneumonia patient who's been bedridden for a week. Let me ask you all, for a patient like this, what is the most critical concern?
Pulmonary embolism.
Exactly. Pulmonary embolism. Especially for patients who are elderly or bedridden for a long time, you must remind them to get up and move around. Otherwise, an embolism is very likely. The mortality rate for an embolism is between 90 and 100%. In as little as 15 minutes, the patient could be gone. In the past, I've seen 6 patients with pulmonary embolisms, and none of them survived. How do you feel?
Doctor, just now, my leg felt a sudden sharp pain.
And now, what are you feeling now?
Right now, it feels like someone is pressing on my chest.
Do you feel any pain in your chest?
No.
Is it hard to breathe?
Not at all.
In a case like this, you must be extremely careful. It's very likely to be a pulmonary embolism. All right, let's go.
Blood pressure is 80/60 millimeters of mercury. Jugular venous distension. Mild edema in the left lower limb.
He's joking. Taking blood pressure by touch? Do you think you're a monitor? Take his blood pressure.
$81/62.
He's just guessing. But that's incredible.
Sir, what's your financial situation? Do you want the expensive medicine or the cheaper ones?
Young man, give me the best medicine. My medical insurance covers 95%.
Okay, then use RT-PA.
Prepare RTPA immediately.
Understood.
Open the green channel for chest pain now.
Yes, doctor.
Pay attention. Do not change the patient's position. Move. Oh no, it's a pulmonary embolism. Resuscitate him now. Administer an RTPA shot. Inject subcutaneous, low molecular weight heparin. Fast! Thrombolysis with RTPA, anticoagulate. With heparin. For over 30 years, I've always done it this way, but of 6 pulmonary embolism patients, not one survived.
Director Wang, their blood pressure is back.
Congratulations, Director Wang. You have saved a patient with pulmonary embolism.
Dr. Xu, I'm really not good enough. The patient survived. High risk. Sudden pulmonary embolism. Revived in under 1 minute.
I'm glad they were saved.
Say, as for the department, have they scheduled you for outpatient service?
At major hospitals, outpatient roles are for department heads and associates. As a mere resident, I'm far from qualified to practice independently.
But can you do it?
Of course.
Good. Go to outpatient. This afternoon, I'll have Wang Fan oversee your work. Sound good?
Yes. Wang Ping just gave me special privileges. It takes most doctors 10 years to get this far. But since starting here, it's only taken me 10 days. The rank of associate director is getting closer.
Doctor, it hurts.
Holy crap. The perks of being a handsome doctor.
Where does your stomach hurt?
In the lower abdomen.
Any other symptoms besides pain?
I have some bleeding. For about 3 days.
Do you have a history of period pain? When was your last menstrual cycle?
I never have period pain. I'm actually late this month.
Lie down. I need to examine you. Point to it. Where does it hurt most?
Right here.
Right here? Does it hurt here? How about this?
It hurts a little. It hurts so much.
All right. Sit up. Are you sexually active?
I'm only a freshman.
Go get an HCG test and an ultrasound.
Doctor, I'm not pregnant. My stomach just hurts. Just give me some painkillers.
Go get the tests.
Xu Chu is incredible. Such smooth questioning. Expert clinical judgment. Handling it so effortlessly. Is he really just a resident? Even a specialist from chief physician isn't this good.
Doctor, please look at these for me.
Ectopic pregnancy. In other words, the baby is growing outside the uterus.
How is that possible? Doctor, can you perform the surgery?
You don't need surgery. It's not that severe. We can use non-surgical treatment. I've referred you to OBGYN.
No! I want to stay with you.
Fine, I'll prescribe methotrexate. If the medication works well, you won't need surgery. Go get admitted.
About that chief physician? I'm not even qualified to evaluate Dr. Xu Chu.
Wang Fan, you need more courage. From now on, all of Xu Chu's cases are your responsibility. Any problem?
No problem. I used to think once Xu Chu arrived, my workload would decrease, and I could push the trouble onto Xu Chu. Now look at me. My status just dropped another level, while Xu Chu gets admiring looks from nurses. and female patients. His status is skyrocketing. Something happened.
It hurts.
Director Wang.
No, it's heavy bleeding from a ruptured ectopic pregnancy. Monitor vitals. Establish 2 IV lines. Call the attending doctor. Be quick.
Doctor!
Dr. Xu. It's the patient for Luo Yitong, ectopic pregnancy, rupture, and bleeding. The situation is under control.
Good.
I'm an attending, so why is reporting to a resident feeling so natural?
Luo Yitong? The one with the ectopic pregnancy?
Yes, in this ward.
Okay. Get her to OB/GYN. I'll schedule surgery as soon as possible.
Good. Can you hand this patient to me?
Are you kidding? Your ER department? If you ER folks want to do it, it's not impossible. Are you Dr. Xu?
It's me.
Pleased to meet you. I'm Li Shui from OB/GYN. However, at OB/GYN, we use laparoscopy, which was recently started. In the whole department, only 4 or 5 people are skilled with it.
No problem.
Fine. Then I'll talk with the department.
Good.
Minimally invasive surgery complete. Rewarding master-level interventional surgery experience.
Seems like I'll have to do this surgery after all.
Ladies, tomorrow Dr. Xu is coming here for surgery. Whether we can keep him is all up to you.
Dr. Xu. Oh my god. Tonight, OB. GYN becomes an allure. We must win him over.
ER and OB, GYN are like family.
I heard several departments tried to keep Dr. Xu, but they all failed. This time, we must get him to stay.
Check-in completed at Linhai Hospital. Impact factor 4.0. Reward bonus multiplier active. Loot quality multiplied by 4. Congratulations, you have obtained master-level dissection and cleaning skills.
There's always someone better, and there are no limits to perfection. The dissection stage of the surgery was executed so perfectly. It seems I'm still quite a long way from becoming a true master.
Dr. Xu, everything is ready. Can we begin?
Yes. Is that Dr. Xu?
She actually woke up even after anesthesia. Is Dr. Xu really that handsome?
Cold. Dr. Xu. I feel a bit cold.
Begin the surgery.
It's so dark. There's severe adhesion inside, and chocolate cysts too.
Good heavens! I found the ectopic pregnancy site. How long has it been? Less than 10 minutes?
Is he really from the ER? Are you sure he hasn't been sneaking into OB/GYN to practice laparoscopy every day? Xu. Xu. Mr. Xu. I'm in awe of you.
Prepare to extract the embryo.
Did the director do this? Dr. Xu is amazing. With technique, this clean, I thought it was the chief surgeon.
Surgery is complete.
Only 37 minutes. The standard time for this procedure is 2 hours. Even for me, it takes an hour and a half. Finishing in 30 minutes, is he some kind of freak? Dr. Xu, stay a moment after this. The director wants to see you.
Ectopic pregnancy laparoscopic resection completed. Grade A. 30 experience points earned. Mission accomplished. Master level interventional surgery experience granted.
Now, even if I had to perform neurovascular intervention, it would be a piece of cake. Director, Dr. Shu is waiting for you in your office.
Is the director done with surgery? We must make sure Su Chu stays.
Girl, help me check. What does this message mean?
It says, Dr. Lee said to Shu Chu that they need to talk to the director. Director, you absolutely must keep Dr. Shu here.
You young people, just to keep a pretty face around. Why are you involving an aging woman like me? That girl Li Shui. What a mess. Xiao Li, you're just in time. You can explain to me. What does it mean that I need? To talk to Shu Chu?
Director, you'll definitely want to talk to him.
Nonsense. He's just a resident. Why would I talk to him? No matter how handsome, I don't think I'll help you keep him here.
Director, he did a laparotomy in only 37 minutes.
You, what did you say? Even if I did the surgery, it would take at least 50 minutes to finish. You guys, the surgery is already finished? What on earth? It's actually finished. I thought this group of people hadn't even started yet. Good work keeping him. In the conference room? I'm going there now.
I told you, the director would definitely want to talk to him.
Chu Chiu, I see you haven't published any papers. The ER is so busy. Where's the time for that? Look, come to my OBGYN department, and I guarantee within a year, you'll have 2 papers out. How about it?
Director, at the moment, I have no plans to transfer.
That's a bit of a shame. No rush. Residents have a 3-year rotation. You'll rotate through pediatrics, gynecology, obstetrics, infectious diseases, and orthopedics, among other departments. When Shu Chu's ER rotation is over, there will come a day. He comes to OBGYN, and he will finally be ours.
I, Wang Fan, am the one who saved her. Realistically speaking, I should at least deserve a bit of praise.
Dr. Zhu! I'm being discharged soon. Do you have anything you want to say to me?
I wish you a speedy recovery.
Just that? Dr. Shu, don't you know, I had severe internal bleeding then. I felt like my time was up. In a haze, I felt someone pressing on my chest. It felt like my bones were breaking. Back then, you were all I could think about. I thought, I must hang on. Hang on until you operate on me.
I fought to save you, but your mind was entirely on another man. Talk about torture, huh? A handsome face, and a miracle worker too. Dr. Shu, you really are a ladies' man. Wait, why are you hiding this?
This is a patient's gift. I should keep it.
Fine, keep it then.
Even though it sounds imaginative, this clearly means more performance pay and bonuses. There's no reason to refuse it.
Congratulations on signing in at Linhai Hospital. Your impact factor is 4.6, giving you a moderate bonus. Great rewards, multiplied by 4.6. Congratulations, you've earned a master-level gastric perforation surgery package. Package details. Simple perforation repair plus subtotal gastrectomy.
Doctor? Doctor? Please save my grandfather.
What happened to him?
About 2 or 3 days ago, he suddenly had stomach pains. He thought it was manageable then, and didn't go to the hospital, but now the pain is much worse.
Where did you seek treatment? Or has he taken any medicine?
He did. He took some kind of painkiller and some stomach medicine.
Okay. Is there any on the feet?
Yes, there is. You really are skilled.
You don't need to speak, sir. It's all right. Burning sensation, severe pain, nausea, and vomiting. The patient's temperature is high, plus there is risk of toxemia and potential shock. It's a gastric perforation. Get an abdominal x-ray. Also, a blood count, coagulation, liver and kidney function test. Must all be done at once.
All right. Thank you, doctor. I'll take him there right now.
Okay. There's a wheelchair over there.
Thank you, doctor.
Thank you, doctor.
Next.
Here, look at this, doctor.
Gastric perforation. Prepare for admission. We need to schedule surgery as soon as possible.
Got it. Whatever you say, I'll go now and handle my grandfather's admission paperwork. All right. Thank you, doctor.
For this case, I recommend going straight for a subtotal gastrectomy. There are multiple perforation sites. If we try to repair them, there are too many to handle, and the process is tedious. The patient probably won't last that long.
That's true. This patient is in his 70s or 80s. At this age, let's just go with a subtotal gastrectomy.
A simple repair is also worth considering. Simple suture for the perforation is also an option.
What are your thoughts?
The patient's condition isn't as bad as we thought. During the examination, aside from high blood pressure, he is actually quite healthy. A major gastric resection would cause his future quality of life to plummet. To the patient, that would be unacceptable. So I recommend a simple suture repair.
Repairing and suturing is too hard. Just looking at the imaging, there are 7 or 8 perforations. Unless the surgery is done within 40 minutes.
Tough. Once we open the abdomen, it will only get more complex. There might be many small perforations we didn't see on the scan.
Leave this surgery to me.
You?
ER called us for a consultation because they can't handle it and need specialists, right? We are specialists in digestive diseases. If even the associate director can't do it, can Shu Chu...
I know you're great at orthopedics and minimally invasive surgery, but digestive surgery is different. Tell you what, I'll operate, and you can assist and learn.
Fine.
Great. I trust Dr. Shu, so I'll listen to him.
All right. Then the plan is settled.
Thank you.
Get everything ready, and once it's set, I'll start the operation.
Wait, is Dr. Shu not the surgeon?
I'm the Associate Director of Digestive Surgery. I've done at least 100 of these surgeries. Don't worry.
The surgeon operating on himself, Shu Chu, a young doctor, mastered a complex bone reconstruction. Shu Chu from the ER succeeds again, conquering laparoscopic surgery in 37 minutes.
Can we let Dr. Shu do the surgery?
An associate director like me is being rejected? Stolen by a lowly ER resident? Fine. If you want Dr. Shu to lead, leave it to him. Regardless, I'll be there. I'll wait for Shu Chu to mess up, then I'll step in to save the day.
The ER's star doctor, Shu Chu. I've heard so much about you.
To perform your own appendectomy, then handle a bone reconstruction and a laparoscopic surgery, that's incredible.
I finally see him in person.
Indeed.
He's so young and handsome.
No wonder patients insist on Shu for the procedure.
Let's begin discussing the plan. The procedure includes an exploratory laparotomy, bowel decompression, and perforation repair. We are all clear on the difficulties involved. It's a tedious surgery that must be finished within 40 minutes. Prep for surgery.
Abdominal retractor. How's this? Sutures. Am I in your way?
Impressive work, Deputy Director. As an assistant, you're much better than the attending, Wang Fan.
With one pull of the hook, you can feel my 20 years of clinical experience.
The surgery is finished.
Surgery time, 28 minutes.
28 minutes? Under half an hour. Dr. Shu is amazing!
This is incredible. The entire procedure was like a work of art. Words can't express how shocked I am.
Deputy Director, we want to learn this too.
To be honest, so do I.
Check the group chat. Dr. Shu has just completed another complex surgery. I heard that even the vice chief of GI surgery found it difficult, yet Dr. Shu finished it in 30 minutes. He's only 24. What a genius.
Oh my God. If I could master just one procedure of Dr. Shu, I'd be set for life. People like us are just filling up space.
Back to the daily grind then.
I was hired with the top overall score, with several published papers, excelling in research and medicine. But after joining the hospital, I have to start as a lowly resident. With such a thin resume, Shu Qiu has already become a star here. When will I finally be able to escape my miserable fate as a mere resident?
Xiao Huan. Send the pleural fluid sample from bed 7 to the lab. Also, Director Zhang wants you to finish those medical records and put them on his desk before your lunch break.
Okay. My talent shouldn't be buried like this. Director, please give me a chance to show what I can do.
It's because of Shu, isn't it?
He's from a mediocre university. Why him? I don't believe I'm any worse than him.
All right. As it happens, ER has a patient requesting a joint consultation with pulmonology. Come along with me. How about that?
Thank you for the opportunity, Director. I'll make the most of this and make a name for myself.
This patient is a bit complicated. Based on the diagnosis from the other hospital, it's suspected lung cancer abscess with an infection. But they haven't been able to pinpoint the specific bacteria involved. Follow me and learn a thing or two.
All right.
The patient is male, 63 years old, mainly suffering from right side chest pain for 10 days and coughing for 2 days. He was admitted the day before yesterday.
Everyone, I think it looks more like a Streptococcus constellatus plus an anaerobic infection. Switching to a high dose of penicillin, combined with metronidazole, should yield better results.
It's possible. The patient has multiple cyst-like spaces, not cavities, which means high pressure. The outer walls are thick and smooth, with compressive atelectasis of the lung tissue and fluid levels within the lesions. The ipsilateral lung has patchy exudates. These symptoms align better with multiple bacterial infections.
Wow. This little resident doctor is trying to show me who's boss.
Before coming here, I requested an urgent lab report from the testing department, asking them for a pus analysis, microbial culture, and a sensitivity test. I believe the results should be out by now.
Stop misusing emergency resources. Rushing tests for a patient like this. How am I supposed to get my lunch break?
How are the results?
If the lab doctor said that, it's likely not a bacterial infection.
The report shows it's not a streptococcal infection.
The patient's gums are swollen, with mild discharge from the periodontal pockets. It's Trichomonas vaginalis.
Shoot you. Are you kidding me? The patient is a man, and he's over 60 years old. If you're going to make things up, at least make it believable.
This is a professional consultation. No one has time for your nonsense. It's likely a rare pathogen. Just use a broad-spectrum antibiotic.
This consultation is over.
This is Director Zhang from Respiratory Surgery. He's worked in respiratory disease for over 30 years and specializes in treating complex bacterial infections.
Previously, I have dealt with similar cases. However, those happened after cerebral hemorrhage drainage, which is extremely dangerous. Now for this one. Our top priority right now is to save the patient first. Xiao Ding, use the quadruple antibiotics. It's just a difficult case. Why would I need Shu Chu telling me what to do? Trichomonas vaginalis? What a ridiculous theory. Let's go. Everything okay today?
Director Zhang, you're truly amazing. My husband's fever is finally gone, and today he can actually talk to me. Once he's discharged, we'll send you a banner commending your miraculous touch.
No need, really. This is just my job. We'll observe him for a few more days, and he'll be good to go.
Thank you. Thank you so much. Just a few more days and he can come home.
Oh my god, he's so hot. This is a dangerously high fever. Quickly notify Director Zhang.
Understood.
What's going on? How did he relapse? Use polymyxin.
Understood, Director Zhang. This polymyxin is respiratory surgery's last trump card. It must bring the patient's condition under control.
Director Zhang, bed 60. The patient is having recurring high fevers again. And the room. It's full of phlegm, vomit, and waste. The condition hasn't improved at all. What should we do?
That's enough. You may go. I'll call Professor. Professor, I've come across a unique case. Professor, what do you suggest?
It must be a superbug. Use broad-spectrum antibiotics, plus albumin and gamma globulin. While covering all pathogens, this will strongly activate passive immunity.
All right, I'll immediately notify the family about the new treatment plan. Goodbye, Professor.
The hospital has prepared a new treatment plan for the patient.
How much will this treatment cost?
It's not expensive. One course is only about $1,000.
$1,000? That's enough for my husband and me to live on for months.
Are you sure you want to stop? I'm telling you, the patient's situation is still very dangerous. If this works, it should be a permanent fix.
We don't have enough money to try again. My love, what do I do?
What a shame. For such a rare case. If we tried a few more treatments and persisted a bit longer, maybe we could have published a new paper.
Hello? The patient in bed 60 with the recurring lung infection is suddenly asking to be discharged. Are they cured already? The patient's condition isn't under control. It keeps relapsing and is very severe each time. The costs are rising too. Are they just experimenting on people? Auntie, you're leaving the hospital?
Yes. My husband's condition isn't improving, and we can't afford the bills anymore.
If the patient leaves now, whether he'll survive 3 days is a complete unknown. Auntie, before you discharge him, let's do one last treatment. It's free, all right?
Let's give it a try then.
Can someone come here and take a sample from the patient in room 60?
Dr. Xu, are you sure? This patient needs a gel aggregation test? That's used to check women for trichomoniasis. This is a man. What are we checking for?
Sorry to bother you, but that's the test I need.
All right. Dr. Xu. 3 pluses. It's a strong positive.
Auntie, I won't be wrong this time.
You use those same words to take our money every time. I won't believe you anymore.
Auntie! This treatment costs between $300 to $500. I'll pay for it myself. If it doesn't work, everything is free. Is that fair?
After everything I said, this young man is still so kind despite my anger. I don't know why, but this young doctor seems so reliable and honest. All right.
The patient in bed 60, how are they doing?
Let me look. Director, about them. They should have been discharged.
What happened?
Director, the patient in bed 60 not only hasn't been discharged, but also threw out our entire treatment plan and replaced it with a new one. And now, they are improving. There are no more major issues.
How is that possible? Who ordered the new plan?
It's Xu Qiu. Also, the new diagnosis is a parasitic infection.
Could it be? It really is. This is unbelievable. Professor, that patient I mentioned the other day, well, now, it's confirmed to be a parasitic infection. Yes, exactly. A resident here prescribed metronidazole plus some herbal medicine. He used 10 grams each of agrimony, sophora, dicroa, mylita, prickly ash, quisqualis, pulsatilla, philodendron, areca, artemisia, and conidium, 10 grams each, to make a decoction.
A resident in your hospital actually had such ideas?
Professor, that doctor.
You can't judge him by the standards of an ordinary resident.
Just because he guessed a rare infection doesn't mean you should overrate him. Xiaozhong, I taught you to stay grounded.
Professor, I've always kept that in mind. He also performed a bone reconstruction. Even the clinical associate experts were stumped by that surgery.
And you call him a resident?
Xiao Ding, don't get ahead of yourself. Just focus on being a good resident. A week ago, he had already identified the true cause, while I and the entire respiratory surgery department nearly ruined a life with our arrogant prejudice. Looking at it now, I was being ridiculous.
Let me tell you, I heard the patient in bed 60 just got discharged. He gave Dr. Shu a banner and a $100 envelope. But that envelope, Dr. Shu didn't even accept it. Dr. Shu is so ethical and so handsome.
But this time, I really learned something new. Trichomonads can pass through the patient's mouth or hands into the respiratory tract, and at the bronchial wall, cause obstructive necrosis. I can't help but wonder about Dr. Shu's mental state when he made this diagnosis.
Dr. Shu's professional skills are too powerful. It's simply...
Congratulations. You have completed a diagnosis of a difficult case. Difficulty grade B. Clinical grade C. Obtained 10 experience points. Experience at 100%. You have earned 1 lucky draw.
So it's not just surgeries. Diagnosing difficult diseases after the patient recovers also grants experience rewards. Draw.
Reward obtained. Master level skin flap transplantation.
What are you all standing around for? Keep up the compressions and ventilation. Ignore everything else. What's the patient's status?
An accident happened at a factory. The boss forced a deadline, and someone dozed off. Due to improper operation, the machine hit the wires, the high-voltage wires. 5 people below were hit, all knocked unconscious instantly.
Electric shock injury.
Dr. Shu, what should we do next? This patient is slipping away.
Dr. Shu, the blood vessels are all blocked. I can't find a place for the needle. If we don't take action now, the patient will be gone within hours.
I'll do it.
Dr. Zhu is truly reliable. Just those 3 words have filled me with hope.
Success. Dr. Zhu completed the venous access, and on the first try.
Prepare for surgery.
Dr. Shu is a god. This medical skill is even crazier than the rumors.
Debridement, such a basic procedure, done so perfectly.
Increase oxygen to 5 liters per minute and rapid fluid resuscitation.
You got it, Dr. Shu.
Contact the ICU. Send them there immediately. They might need ECMO.
Good work, Dr. Shu. We'll take it from here. If not for Shu Chu tonight, the ER might have actually lost someone today.
Shu Chu. Sit down.
Director Wang.
I heard about last night. You did an excellent job. All 4 patients are out of danger. One needed an amputation, but they are in stable condition. The biggest trouble now is that patient sent to the ICU.
That's the patient I personally rescued. Is something wrong? Can they not be saved?
Your rescue was outstanding, and the patient hasn't shown signs of major infection. However, if the necrotic area and the infected area were any worse, he'd have no choice but to lose the arm. Yes, now, he wants to save his right hand, but the cost is too high. He wants to save his limb, but the salvage surgery is extremely difficult. At Linhai Hospital's burn unit, few doctors are confident enough to perform it. Besides, the patient's family is very difficult to deal with. If the surgery fails, the doctor will face endless legal disputes and harassment.
That's true. However, I recently mastered master-level skin graft techniques. This ICU patient's limb salvage happens to require exactly a skin flap transplant. By relocating healthy tissue, we can fill the gaps, aiming to restore the arm's function and appearance. Director Wang, I'd like to try this surgery.
You've studied burn surgery too?
Well, I had a sudden epiphany recently.
Are you joking with me? Actually, this patient has been sent to the nearby International Friendship Hospital. There's a top burn surgeon visiting for a session, and he agreed to do this as a favor. Want to come with me to see it for yourself and learn something? He is a world-class burn specialist. Usually, you'd only see a man like him in a textbook.
Sure thing.
Since you're interested, observing him will be good for your career. But be warned, this specialist has a unique style, so don't be too shocked.
Got it.
Let's go.
No wonder he looks so familiar. He's one of the editors of the latest edition of Emergency Burn Medicine. Now, we just wait for the surgery to start.
Shu Chu.
This is the class monitor from university. Jia Lin.
It really is you, you rascal. You actually got into the conference room? For this surgery, are you following to observe? Just a heads up, Elder Meng has a terrible temper. When we get in, stay in the corner. If you can't see, just leave it. Just try to fly under the radar.
Thanks.
No problem. Us residents don't have many rights anyway. We've got to look out for each other. Though for this chance, I had to beg the director for ages.
That's rough.
It's fine. That's just life as a resident. Let's go. So after all your sad talk, it wasn't empathy? You're just pitying me?
Let's begin the surgery. As for this patient's debridement, who among you performed it?
Elder Meng, before the patient was transferred, the debridement was already done.
Elder Meng, it was done by a resident at our hospital. It was this person, Shu Chu.
A resident? Back in the day, even attending physicians would be ripped to shreds by Elder Meng for their debridement. A mere resident's surgical skills actually satisfied Elder Meng's high standards? That's impressive.
Not bad. Come, step forward.
Old classmate, why does this resident get treated differently than us?
What an agile Z-plasty rotation. This correction of triangular scar contractures is so skillful. As expected of the technique Elder Meng created, we're finally seeing the Grandmaster in action.
Elder Meng's surgery is excellent. Even with my master-level skin flap grafting, I can't find many flaws.
What is it? Do you have some better insights?
Just as I thought, Shuqiu must have done something to upset Elder Meng. Elder Meng is offended now.
Meng, Elder Meng, the kid means no harm.
Shut up. You were just frowning. Did I do something wrong here?
The flap position is slightly off. If it stays this way, stitching the wound will create too much tension.
Previously, I tested everything. This angle should be perfect. True, the fascia in the upper right limb will compress during suturing, causing the flap to shift.
Exactly.
A talent indeed. What's your name?
Shuqiu.
Come, step over here. Make him the first assistant.
I was still watching from outside. How did Shuqiu get over to Elder Meng's side? And even better, he managed to push out the head of burn surgery.
A resident? He's just a resident from Linhai Hospital. This is humiliating for the rest of us.
The difficulty of this surgery is even higher than I initially estimated. I already performed one major operation last night. Today, I really feel exhausted. Can this kid really handle this? What am I thinking? I'm doing this surgery only because nobody else can. If a mere resident can pull this off, then every chief and associate chief of burn surgery here
would be total failures, wouldn't they?
Continue. The patient's heart rate is spiking and temperature is rising. If we can't find the cause, we'll have to give up on saving the limb and stop the surgery.
Heart rate's at 170.
This is...
Wait. The blood? Why is he bleeding?
Elder Meng, did you use too much epinephrine?
At a time like this, why bring that up? To maintain a bloodless field, I did use epinephrine to stop the bleeding. Could it be? Is it the epinephrine?
Oxygen levels are dropping.
Damn! Anesthesiologist, check the airway.
He's suffocating. The bleeding caused pink, frothy fluid, which will eventually block the airway.
In this situation, if we don't fix it now, it's not just about losing a hand. Actually, he might not make it off the table alive.
The lungs. Pulmonary embolism. Quickly call for a cardiology consult.
Too late. By the time they get here, he'll be gone. Nurse, apply the coupling gel.
You can do this? Are you betraying your career with a joke like this? A resident physician like you performing surgery alone without a consult on an embolism. Do you know what that means? This will end your medical career.
Elder Meng, I'm Linhai Hospital's Wang Ping. I vouch that he can do it.
Wang Ping? Is that the one known as the backbone of ER medicine, especially skilled in critical respiratory care? The same Wang Ping?
Yes.
You'll vouch for him? Instead of doing it, you'll let him take the fall? Save the patient. Hurry.
Elder Mong, you overestimate me. In over 30 years, 6 patients with pulmonary embolisms have been lost on my watch. The success rate is 0%. The only one ever saved was done so a week ago by Shu Chu. It was all them. Apply the gel. I'll assist and take your lead. Understood?
Shut off the nitrous oxide. Give 100% pure oxygen. Adjust the seat to semi-sitting. Insert the catheter. Give 20 milligrams of furosemide, 8 milligrams of dexamethasone, and 100 milligrams of hydrocortisone.
This young man, it looks like he might pull through. Why are you staring? Shu Chu is in charge.
Yes, sir.
Localized wall motion is reduced. Ejection fraction is at 20%. Cardiogenic pulmonary edema, combined with an embolism.
Test TT, PT, and APTT immediately. Administer urokinase, heparin, and 500 micrograms of digoxin via IV push.
Yes, sir.
Stable. Systolic pressure is at around 100.
Dopamine at 7 micrograms per minute, per weight. Keep systolic pressure above 90. Stop dopamine. Switch to dobutamine. Drop the dose to 5 micrograms.
Wipe Dr. Shu's sweat.
Excellent. He's been saved. This Dr. Shu, is he the protege of some cardiology titan?
Elder Meng, we can proceed with the surgery.
Because of this emergency, the rest of the operation must be finished within 30 minutes. Next up are the most critical bipedical flap transplants. Elder Meng's condition is unstable, and I'm afraid she won't make it.
30 minutes. Who among you can perform this?
I'm not that fast. I'd need at least an hour. In the entire industry, only a top expert with your skills could work at that speed.
Didn't you claim you could do it earlier? If I give this case to you, how long would it take?
20 minutes.
Are you kidding me? Unbelievable. Arrogant rookie. Even if I were. At my physical peak, the surgery time could only be cut down to 30 minutes. It looks like I have no choice but to push through myself. Shu Chu. Take over.
Yes, sir.
Surgery complete. Final time, 18 minutes.
He really did it in 20 minutes. Look at the sutures and grafts. This young man is incredible.
Dr. Shu took over in a crisis and performed brilliantly. Such nerves of steel. His skills are insane.
Absolutely.
Oh my God, he's a god of surgery.
Without Shu Chu today, this operation likely would have failed. How can a 20-year-old resident surgeon possess such incredible operating skills?
Elder Meng, please, don't see us out further. It's getting late. Go back and get some rest. We should be heading back too.
Thanks for all your hard work.
Go, quickly, go. Look at them, watching us like hungry wolves. If you're too slow, who knows? They might try to steal you from our hospital. Hurry, hurry, off you go. Goodbye, goodbye.
If I could only take him as my student, I would have no regrets in this life.
Elder Mung, let's go back.
Okay.
Shu Chu. Shu Chu. I remember now this Dr. Shu, it seems he applied here before.
What? Why is he at Linhai Hospital then? Why?
Us? Did we reject him?
What? How could HR reject a talent like this? Pull up Su Chu's resume. I want to see it for myself.
He's just an ordinary undergraduate with no published papers.
A genius with a resume like this.
Our hospital has an alumnus of Shu Chu named Jia Lei.
That clumsy, incompetent fellow? I'm overthinking it then. Jia Lei's dullness is the true standard for a resident from a second-tier school.
Director!
Shu Chu, I'm really starting to find you more and more mysterious. Let me buy you dinner tonight. Do me that honor.
Sure. I'm not on duty today anyway.
Great. I'll wait for you at the entrance.
All right.
Not bad, Dr. Shu. Our Director Wang is a total henpecked husband. His wife is always terrified that Director Wang will be tempted by sultry nurses, pretty sales reps, or even young female students. So, Director Wang never eats out with anyone. Inviting you today, Director Wang must have really changed.
I heard you went to watch Elder Meng's surgery today. Well, were you scared?
Indeed I was.
Right?
If I hadn't gone, the patient's life would have ended. Anyway, I'll be going now.
Isn't this deputy director my old classmate from International Friendship Hospital? Why are you calling me at this hour? Any orders?
Shu Chu, from your department. What's the deal with him?
Shu Chu? He just finished work and left. Is something wrong?
Were you in the Special Forces? How are you so calm?
What's going on?
You don't know yet, do you? You know about Meng Ying'an, right? Elder Meng messed up during the surgery. Nobody could take over. Then that Shu Chu from your department, he just stepped up. He finished the surgery himself. And he did it even better than Elder Meng.
Did you guys hear that? I just asked Shu Chu if he was scared by Elder Meng's surgery. Me? I'm such a joke.
Oh my god. This makes no sense at all. Is he using some kind of cheat code? Lin Xie? That's Meng Ying'an.
Exactly.
Shu Qiyu is really going to crush experts nationwide and outperform all the legends.
For Shu Chu to do something like this, isn't it normal?
I'm not going home. I'm staying here. Time to work harder. Otherwise, I'll be worse than an intern. I want to cry.
Work. Work harder. Starting right now.
Back to the grind.
Let's get to work.
Director Wang, thank you for treating me to dinner. I brought some local specialties for you.
My boy, there's no need to be so polite. This young doctor is not only skilled, but also handles things flawlessly. I'm so impressed. Shu Chu. I recall you only have a bachelor's degree, right?
Yes. I wasn't thinking about degrees before. I was just obsessed with surgery.
No wonder your clinical skills are so solid. A talented young doctor like you would be highly valued anywhere you go. Have you considered Getting a higher degree?
Degrees do affect my promotion. With a master's degree, becoming a deputy director would be much faster. I plan to get my master's.
Good. Then I will officially introduce myself. I graduated from Tiandu Union Medical University. I am currently Director of Emergency at Linhai Hospital, Professor at Linhai Medical University, a PhD supervisor, a member of the lung cancer research group at Daxia Medical Association, and Vice Chair of the Pulmonary Embolism Research Association.
Director Wang? Now that I'm applying as a non-student, going through the recommendation path might be a bit troublesome.
Don't you worry, I'll find a way for you. At Linhai University, we have the authority to set our own cutoff score. If you're not confident, I can talk to the university to lower the interview requirements by 80 or 100 points.
Lower the cutoff score? Just to admit me? Based on Director Wang's look, he doesn't seem to be joking. However, I want to take the exam mostly to see if I can break the record and make up for the 20 points I lost in my previous life. A perfect score is my goal. Director Wang, there's no need to lower the admission score for me. It's not an issue.
All right, then I'll wish you good luck. On your exam in advance. Come on, let's go eat.
This intern is gorgeous. She'll definitely be a top-tier doctor later.
Great. Finally, I'm interning at Linhai Hospital. Shu Chu, I'm coming for you.
You're Dr. Shu's former patient.
Sister Susu. It's me. I'm a medical student too, doing my 5th-year internship.
You'll do. Go to exam room 7 and assist Dr. Shu's clinic.
Oh my god. It's a dream come true. Thank you, Sister Susu. Dr. Shu, I'm the intern for your outpatient shift.
Oh, it's you. How's your wound healing?
Fully recovered. Dr. Shu, look. There's not even a single mark.
Do you know what to do during an outpatient shift?
I need to prepare sheets, guide patients for exams, and get everything you need before your checks.
Call in the next patient.
Patient 7, you may come in.
What's bothering you today?
Doctor, I've been coughing for days. I drank several bottles of syrup, but nothing helps. And my chest hurts too. Before coming, I checked. It was 38.2 degrees.
Lift your shirt so I can listen.
Okay.
In the past month, have you had a cold?
No.
When did this coughing start?
It got severe in the last 2 days, and medicine isn't working.
Was it there? Before it got severe?
Yes. I had a slight cough now and then, for several years.
I'll order a chest CT and a sputum culture.
All right.
Mr. Shu, he almost confused me just now. It turns out, he's had symptoms for a long time.
Patients often subconsciously overlook many details. As doctors, we must decipher the true meaning in their words.
I understand.
Call the next one. Patches, nodules, and streaky shadows. These are symptoms of tuberculosis, but they're not typical. Let's wait for the sputum culture results.
All right.
Hello?
Dr. Shu, regarding this patient, even though the TB bacilli test was negative, we can't rule it out. In clinical tuberculosis cases, the bacteria is only detected in 20% of patients.
Okay, I understand. The condition is still not very clear, so I suggest getting a bronchoscopy.
Sure. No problem. As long as you cure my illness, money is no object.
Who knew an intern could be this useful?
Professor, is something wrong?
It's nothing. Call the next patient.
I say, Doctor, can you actually do this? If you're not up to it, I'll fly to the capital to see an expert.
Rectal infection. Have you been injured before?
How did you know? A few years ago, I went for BBQ with friends. I got drunk and fought with the next table. Those guys were no match for me.
BBQ. Bamboo skewers? Go get an enhanced chest CT. And a 3-dimensional reconstruction. It's a bit pricey. Is that all right?
Of course it is. Order whatever. I have plenty of money.
Professor is amazing. No matter the test, the patient doesn't object at all.
It seems this girl really doesn't know how much power she has over men. Go call the next one.
Doctor, what is this thing?
Your coughing started right after your last fight.
It seems so. I don't recall clearly.
This thing, if I'm right, is actually a barbecue skewer.
During that fight, someone was stabbing with skewers? But this can't be one. If something this long stabbed into my body, how could I not know?
Organs differ from skin. They have very few sensory fibers, reacting very little to stabs or cuts. You must have drunk heavily then, so drunk that the skewer entered without you feeling it. During the fight, the entire skewer went inside, and when you woke up, only a tiny hole remained. Once you were sober, you naturally felt nothing.
So, doctor, what should I do?
The only option now is chest surgery to remove it. If it stays in, inflammation persists, and repeated infections can lead to sepsis. If it causes right heart failure, you won't even have a chance for surgery anymore.
Doctor, I want the surgery. Please save me.
I heard Dr. Shu saw a patient today with a barbecue skewer stuck in their lung. With such a tricky case, he actually diagnosed it the very same day.
A while back, another patient was in a similar situation. He had 3 years of tuberculosis treatment, only to find a fishbone stuck in his lung that went unnoticed. Eventually, he developed heart issues. With no chance for surgery, it was hopeless.
Shu Chu was my future student. His excellence makes me so proud. But who should perform this surgery? That skewer has pierced most of the lung, and also, it's penetrated the left pulmonary artery. Once it's out, major bleeding might occur, making the rest of the job even more difficult. The difficulty and risk of this surgery are already at the peak level. No, I must report this immediately.
You have checked in at Linhai Hospital. Impact factor 5.3, earning a significant bonus. Reward richness 5.3. Congratulations on obtaining master-level superconducting visual bronchoscopy interventional surgery.
I inherited master-level intervention experience before. Now my understanding of interventional surgery has leaped even further. This procedure is perfect for minimally invasive foreign body removal. Looks like that man's surgery is all set now. How are you feeling?
Doctor, no need to make such a big deal, okay? I'm doing great right now. 3 days from now, there's even some huge hospital-wide consultation. Honestly, you guys...
Diazepam, anti-shock, hemostatics, now.
We can't wait 3 days. Start the hospital-wide consultation immediately.
We can't delay any longer. The bamboo skewer shifted. If not removed in time, it's a fatal risk. In all my years as director, even I wouldn't dare operate. How is it possible? and he just happens to be able to do this.
No need for open chest surgery. This patient can undergo superconducting visual bronchoscopy interventional surgery.
Minimally invasive intervention? Too difficult. Even with an open chest, trying to stop massive bleeding is extremely hard. A tiny incision from an intervention cannot stop that blood.
This surgery, I will do it.
Dr. Su, don't push yourself. Both intervention and cardiology said it can't be done. For specialized cases, we in emergency shouldn't interfere too much.
This surgery, emergency will take it. If anything goes wrong, I will take full responsibility.
Dr. Wang?
Shu Chu, are you sure you don't need cardiology and respiratory teams for a joint surgery?
No need. For this surgery, I'm 100% sure of success.
All right, I trust you. I have surgery this afternoon too, so call some deputies to help and wait for the good news.
With my master level experience and top tier guidance and bronchoscopy skills, having others help would only lower my success rate.
Who is Shu Chu? Oh, so you're Shu Chu?
That's me.
You're too young. How can I trust you with my brother? Just because he has a Pikachu tattoo, you think he's a pushover? You're practicing on him? Switch doctors? Get someone else now.
Wait a moment. I'll call the director. Since Wang Ping and He Hai are in surgery, I'll have to get Director Zhang Kongshan. Director Zhang, could you come over for a second?
Hello, I'm Director Zhang Kongshan, and I'll be participating in this surgery.
Looking at those wrinkles, okay, fine.
Xu Chu, Wang Ping is vouching for you. If anything goes wrong, Wang Ping is basically finished in the medical field.
$10,000 IU of heparin, inject through the carotid sheath, then coronary injection with 200 micrograms of nitroglycerin.
You plan to block the pulmonary artery first, before doing surgery? This operation has very strict time requirements. Beyond 3 hours, it could multiple the chance of infection. Interventional catheterization already takes forever. But Shu Chu wants to add stent placement and occlusion. Is that even possible? This is beyond magical. How can the guide wire in his hand to be so precise?
Prepare for ultrasonic retrieval.
The surgeon, Dr. Shu, is so calm he's not even sweating, while Director Zhang, the first assistant, is acting like a complete amateur. He's way too nervous. For an object located...
Forceps.
Shu Chu's hand is so steady while cutting the bamboo stick. If it were me, at the very first cut, the stick would have already shifted. It's finished. A foreign object nearly 8 centimeters long, pierced through the lungs, and it was retrieved through intervention. I can't believe it's done. unbelievable. Absolutely perfect technique. Shu-Chu, why don't you join my department? I'll file a patent for you and put you in charge of cardiothoracic interventional procedures.
Director Zhang, no thanks. This is just side work for me.
This is just your side work?
Congratulations on completing the superconducting video bronchoscopy intervention surgery. S-rank performance. Gained 45 experience points. Plus a bonus, 3% mastery in superconducting interventional retrieval. Progress until next draw. 95 out of 100.
Great. Just one more surgery, and I can do a lucky draw. As my mastery improves, my understanding of interventional retrieval has leveled up again. If I can perform one more, I can cut a few more minutes, bringing the surgical time down to 40 minutes.
Doctor, how is it? My friend didn't ruin everything, did he?
The surgery was successful. He'll be in the ICU for a day or two, then he can move to a regular ward.
Lucky I asked for you. If it were that young doctor, heaven knows what would have happened to my brother. Maybe he would have been finished right there on the table.
Look, this procedure is something only a few in the whole province can pull off. And I wasn't the lead surgeon. It was the young doctor who just left.
That guy? He looks younger than me. Doesn't even have a single wrinkle. Is he really that good?
One hour and 5 minutes. Not bad. Where's Shu-Chu? Which operating room is he in?
One moment, Chief Physician. Let me find him for you. He has no surgeries today.
Strange. Could it be? He went to the cardiac surgery theater? I'll check.
Wait, Chief Physician, I found it.
Which room?
He finished his surgery 10 minutes ago.
50 minutes? In such a short time, what could it be but a failure? Unless, halfway through the procedure, did the patient bleed out, forcing him to terminate?
Chief Physician, the surgery didn't fail. He was sent to ICU for observation. Would you like to see the report?
I feel like, at this rate, I'm not even fit to be his mentor anymore.
Shu-Chu is an asset to our hospital. I want every department to be able to work with him.
I still suggest that Shu-Chu stays in the ER to specialize.
Stop arguing, everyone. I am issuing an announcement. This notice is about the provincial under 30 elite medical team selection for the National Surgical Excellence Competition.
This is perfect for our Dr. Shu-Chu. Winners get massive rewards, and their hospitals will receive free equipment worth tens of millions of dollars. Trouble is, it's held during the postgraduate exams.
If Shu-Chu competes, he will definitely break Linhai Hospital's history of failing to win a prize. If it doesn't work out, it's held every 3 years. Let Shu-Chu compete when he's 27.
Send the notice to Shu-Chu first,
so he can be prepared.
Okay.
Thank you, Doctor. The provincial selection. The dates clash with the exams. If I finish the test within 1 hour, and rush there, I'll make it in time, winning the top surgical prize. Grants eligibility for $100 million research funds and access to national-level laboratory resources. That will bring me closer to being associate director. Never mind. For the next few months, I'll focus on building the team.
The entry barrier 4. This competition isn't ordinary at all. Dr. Shu, you're entering?
Yes.
Dr. Shu will surely get great results.
With me as the lead surgeon, I just need a few doctors under 30 who are healthy, not starving, and staying hydrated. That should do it. Call the next patient.
Dr. Shu, did you just finish surgery?
Yes, I did.
Good work.
Congratulations on winning the prize. You've gained master-level radiotherapy lesion localization experience.
It wasn't a surgery this time, but rather the ability all oncologists dream of. Lesion localization. Director Wang, regarding the oncology department, could you send me some of the radiotherapy plans they haven't implemented yet?
No problem, I'll send them shortly.
Dr. Shu, these are the treatment plans from the oncology department.
That was fast. Are there any medical records? It's okay if you don't have them.
I do. I'll go get them for you.
All right. These radiotherapy plans can be reduced by another third. The scope is a bit too large. This part is redundant. There's an unnecessary radiotherapy area right here.
My goodness. Professor is incredible. He even knows how to locate radiotherapy targets. Even the oncology department needs help from Professor. Professor is simply amazing. I'll deliver this quickly. We can't delay the patient's treatment.
Isn't this the plan your ER requested? Why are you sending it back now? And with all these scribbles?
How irritating. He dare call Professor's work mere scribbles. Wan Huaiwen, an attending physician in oncology. A mere attending doctor, and he dare disrespect Professor.
Young lady, I'm the one who sent this plan out. Now it's back. Modified by Shu Qiu? Why is the ER interfering with oncology matters? Even Shu Qiu has to learn from me. Give it here. I'll check it over and see how he defined the target area.
Dr. Wan, we won't trouble you with that.
What are you guys discussing now?
Director Qiu, this is the modified proposal by Dr. Shu. Please take a look.
Since it was revised by Dr. Su, I should give it a close look and see if Dr. Shu is a natural at chemotherapy.
These are the 3 patients set for radiotherapy today. Hurry, hurry! Let's see what the ER genius can do.
quickly contact radiotherapy. Delay the chemotherapy for these 3 patients, and follow Dr. Shu's instructions to re-plan everything.
All right.
I can't believe this was finished in under 15 minutes. By the way, miss, could you pass on a message to Dr. Shu for me?
Director Chu, please go ahead.
Ask Dr. Shu if, when there is time, they could give a lecture. To the oncologists? How about it?
Sure, I'll make sure they get it. Director Chu, I'll be going then.
Understood. I'll go when I have time.
Professor, you're absolutely incredible. I will definitely learn from you.
How's the wound recovery going? Stop taking that off. I'm not looking.
Is Professor feeling shy? It healed perfectly. There's no mark at all. You can't even tell there was an appendicitis surgery.
This girl. Does she really not see me, her mentor, Professor, as a man?
Dr. Shu, you're here.
Such misfortune for our family. My husband and my eldest son were both lost in a car crash. My eldest daughter-in-law ran off with someone, and my second daughter-in-law took her child back to her family. Now my second son has ended up like this too. Why is my life so cursed?
Ma'am, we will do everything we can to save him. Please wait outside.
Patient info.
Shen Baokai, male, 43 years old. 30 minutes ago, the patient suddenly collapsed, lost control of the vehicle, and caused a car accident. Cause of unconsciousness is unclear. However, all on-site physical indicators appeared normal. Pupils are equal and round, and light reflex is sensitive. His mother said the patient has a history of hypertension. The patient's brother had a vascular event due to high blood pressure and was lost in a crash.
Notify radiology. Arrange a cranial CT. Talk to the family for consent. And issue a critical condition notice. Once stabilized, take him straight to radiology.
Right away.
Also, set up an IV line.
Copy that. On it now.
Start ECG monitoring. Check his blood sugar.
Sugar is 5.7. Blood pressure is 172/96 millimeters of mercury. It's a ruptured vessel caused by hypertension.
For my examination, this doesn't feel like a high blood pressure accident. Get a blood count, check liver and kidney functions. Something is wrong. Doesn't look like a drug overdose either. Wait for the CT scan. Even with my skills, I'm actually a bit stumped. The patient's kidneys are smaller than those of a typical adult. Serum creatinine is 365. It's hypertensive nephropathy, but that shouldn't cause a coma. If we can't find the real cause, there will always be a time bomb ticking inside him. Sinus tachycardia. It's not a cardiocerebral infarction, but we can't rule it out yet.
Doctor, please save my son. What is wrong with him? Whatever tests are needed, we'll do them all, no matter the cost.
To completely rule it out, we need to wait 24 hours, then perform another CT scan. Alternatively, we could do an MRI.
Do it. Do the MRI.
An MRI takes 30 minutes. Even a healthy person finds it taxing. In his current condition, the risk is extremely high.
Then what should we do?
I'll go check on him again.
Director Wang,
The patient's nose is bleeding uncontrollably.
Stop the bleeding.
Son. Son.
Hypertension, renal dysfunction, shock hepatitis, increased white blood cells, decreased platelets, mild anemia. What on earth is this disease? Call the ICU doctor. If things don't improve, move him there. The ICU has all the life support equipment. As long as you can pay, even if his heart or lungs fail, machines like ECMO can keep him alive for several weeks or even months.
Everything I can think of has been ruled out. It's hard to say. Moving him to the ICU is best. At least he'll be stable, while we continue the investigation.
All right, but we need the family's consent.
To save his life, we'll sign.
Okay, come on.
This. The bone is broken.
Oh my goodness. These nurses broke the patient's bone.
The patient's condition was already poor, and now there's a fracture.
Son.
Ma'am, I am so sorry. The patient is older, so osteoporosis is inevitable. And while moving him, accidents can happen. Don't worry. I'll call the orthopedic doctor over, and all related medical costs will be waived. Ma'am?
Old man, this is karma.
This isn't how it was supposed to go. What happened?
Ma'am, get up. Get up. Get up. Get up, ma'am. Get up.
We aren't going to the ICU. I'm taking my son home.
Wait.
Ma'am, if the patient goes home, under these conditions, he won't last 1 week.
It's true.
Our family deserves this karma. Son, we're going home.
Morning, Dr. Wang.
Morning.
By the way, how is Shen Bao Kai? Doing now?
Him? He's about to be discharged.
Found the cause so fast?
Not exactly. His mother stopped the treatment. She gave up on it voluntarily. She had already signed the consent form. But then, our nurses broke his bone while moving him. Then Director He, scared of a lawsuit, forced him to stay to treat the fracture.
A fracture? A man in his 40s gets a fracture just from being moved? That's not right. Didn't the mother say she'd pay any amount for treatment? Why the sudden change of heart?
I only found out hearing nurses talk during the night shift yesterday. I can only say, it's truly satisfying.
What's going on?
His father was also a doctor, but he ran an illegal clinic that focused on strictly prohibited gender identification. Moreover, he even provided patients with drugs and surgical procedures to end pregnancies. Let me tell you, every year, hundreds of girls were lost in their house. He even, to make a profit, would intentionally misidentify boys as girls. Until one time, a pregnant woman refused to give in and delivered the baby. It was a boy, and everything was exposed.
That old woman seems quite educated. How could she do such things?
You tell me!
Auntie, has his vision declined lately? Auntie, these past few days, did his vision get worse?
My son said several times that he couldn't see clearly and needed glasses. I thought then it was bad karma. How does someone in their 40s suddenly become nearsighted?
loss of vision, and even blindness is also a symptom of a nervous system disease.
You ordered for him serum biochemistry and bone marrow biopsy. Are you suspecting he has multiple myeloma?
Correct. Let's wait for the results.
If it's truly this disease, then it's truly retribution. It's a rare disease, often called the bone-eating disease. In 30 years of practice, I've only seen it once, and it's almost beyond cure. It really is a blood disease. If not for Shu Qiu, I never would have thought of it.
Today, the patient's family was cleaning the patient's body, but they accidentally broke the patient's bone. The fracture caused a blood clot, which led to a pulmonary embolism. Today, Director Wang and Dr. Xu were both out of the hospital. So Director He told me to rush the patient into the ICU.
The startup cost for ECMO is $110,000. Plus, daily operating expenses are at least $13,000, plus costs for other life support equipment.
Save them. Spend whatever it takes. As long as you save them, I will donate all my savings to the heavens above. Please, help them.
The case is unique. If we use chemo, the damage is too great. It's hard to make a plan.
The follow-up treatment. Any ideas?
It's difficult. Chemotherapy is too risky here. Might as well wait for a marrow transplant and hope for the best.
Thousands of people nationwide are waiting for bone marrow, so finding a match for Shen Bao Chai is incredibly rare. Waiting for a transplant is like waiting to be gone.
Right. Dr. Su Chu, will you take a look?
This is oncology business. Why ask Shu Qiu?
Think Shu Chu doesn't know? His targeting is better than mine.
What? You sneaky kid. You've been hiding your skills in the oncology department.
Combine bortezomib, thalidomide, and lenalidomide, plus long-acting glucocorticoids.
That's it. That's the answer we've been looking for.
Just how many tricks does he have left?
Oh my. Every move he makes is like a true master. He really is a hospital star, doctor.
Dr. Wang. Dr. Su, lately you haven't just performed a hysterectomy, but you also helped oncology remove a parotid tumor, and you even repaired an incisional hernia.
It's true. This is just incredible. I'm telling you, our Dr. Xu is now the hospital's ultimate role model.
Did you hear? Shen Bao Chai was discharged. The old lady donated to a local temple $800,000.
800,000?
That's a fortune. If she gave that to our department, it would help so many patients who can't afford their bills.
Come in. What's the matter?
We have a patient with stage 1 cervical cancer. I'd like you to review the surgery and check the chemo plan.
Let me see.
The cancer hasn't spread to other areas, so we could have removed the whole uterus. But she wants another child and desperately wants to save it. I need your advice on the surgical approach and the follow-up chemotherapy. Dr. Xu is so handsome, truly handsome.
Follow my plan and perform a cervical conization plus a pelvic lymph node dissection. Start with a TP regimen using paclitaxel and cisplatin. If she can afford it, add bevacizumab.
Got it. Dr. Xu, can I buy you dinner tonight as a thank you?
No need.
Dr. Xu, there is one more thing.
Go ahead.
Dr. Zhong from neurosurgery seems to be entering a major competition soon. He's putting a surgical team together and invited me to join. This competition is apparently only open to those under 30 years old. Have you signed up yet?
Surgeries have been so busy lately, I actually forgot all about Great Xia, famous sword competition. I'm planning to sign up.
Then, for obstetrics and gynecology, do you have someone in mind? If not, would you consider me?
Is the requirement to have people from every department?
Not exactly, but the surgeries are randomized. No one person can master every single type of surgery. So, the team needs specialists from neurosurgery, brain surgery, orthopedics, cardiopulmonary, and pediatrics. Whatever surgery is drawn, the corresponding specialist will take the lead.
It seems they aren't looking for one genius, but an elite team that represents the future. An elite team. Fine. You're on the team.
Great. I'll head out then. This is amazing. I get to work with Dr. Xu.
Director Wang.
I just finished a surgery and saw your message. If you're entering the competition, what about your post-grad exams?
I have time. I'll finish the paper in 1 hour and make it there in time.
All right. Since you've decided, I'll submit your name first.
Zhong. Regarding the competition, the hospital discussed it and felt that the team leader needs to be reconsidered.
You're replacing me. President He. In terms of skill, I should be the top among the attending physicians. For those under 30, who is more qualified than me?
Zhong, the papers you published recently were of good quality. Publish one more SCI paper, and by next year, I'll recommend you for deputy director.
President He. Just tell me who it is, so I can put this to rest.
It's Xu Chu from the ER. You've heard of him, right?
I see. It's Xu Chu again. That guy has a big reputation. But a kid in his 20s is qualified to lead? Everyone. President He wants to appoint Xu Chu as the team leader. I don't want to be second place, so I'm dropping out of the competition. Are you guys still joining?
If Big Brother Zhong isn't competing, how could Linhai Hospital ever take first place? I'm quitting too.
I'll pull out as well. A waste of my time.
Me too. I only trust my brother Zhong Wen.
Wait,
Isn't Choo just some influencer hyped up by the hospital? Isn't he just used for his looks to get our hospital some more publicity?
Exactly. He's in his 20s, and surgeries that experts couldn't even finish, he can do them. Anyone in medicine knows that's total nonsense. Him, as team leader, he should just go home and sleep it off.
My team is full of the elites under 30 in Linhai City. Unless the director doesn't want results, otherwise, he'll have to beg me to lead again. Hello?
Dr. Zhang, come quickly. The stroke patient you're in charge of. It's an emergency.
Doctor.
What was the patient doing before this?
I just told my dad a joke.
What a devoted son. Laughing or coughing can cause a collapsed lung. The patient likely has a pneumothorax. It might be worse than I thought. Go call the respiratory department.
Okay.
I'm afraid it's more than a collapsed lung. We need further tests. It could be a tracheoesophageal fistula. The patient's physical condition is so poor, normal surgery won't work. He needs a minimally invasive procedure. Ideally, Da Vinci robotic surgery.
Does anyone in your department know how to use the Da Vinci?
No one here can do it. However, I'm not sure if Dr. Xu can do it.
Shoot you? Shoot you again? I'll see for myself. What the person who stole my spot as leader is really worth. Go find Shu Qiu. Saving the life is what matters.
Dr. Xu, the neurosurgery department just transferred a patient with a pneumothorax and possibly a tracheoesophageal fistula. Please help us take a look.
All right, I'm on my way.
This guy's just good looking, but doesn't look professional at all. With that thick black hair, he doesn't look like a medical genius.
As expected of Dr. Xu, still so smooth and efficient.
How is he so fast? In just 10 seconds, he finished it?
It's atelectasis. When you were ventilating the patient, he was already unconscious.
No. When I started non-invasive ventilation, he was still conscious. I diagnosed pneumothorax.
Your diagnosis was wrong.
How is that possible? His symptoms were classic.
Dr. Xu, are you suspecting the patient went in a diabetic hyperosmolar coma?
The patient hadn't completely lost consciousness then.
I suspect a tracheoesophageal fistula. Take him for a laryngoscopy and a CT scan.
Laryngoscopy is fine, but no CT scan.
Why?
It'll leave documented evidence.
His first concern is actually whether it would be used against them. I'm taking over this patient. I'll take full responsibility. Go do the CT scan.
Shu Qiu. Can you operate the Da Vinci robot?
This surgery. I already mastered it through my previous check-ins. Combined with my expert surgical experience, this will be easy.
What is the Da Vinci surgery?
A surgeon manually operates a robotic arm to perform high-precision moves. Da Vinci surgery is incredibly precise, minimally invasive, and offers a rapid recovery. Its curative effects far exceed normal surgery.
Is it expensive?
Around $150,000.
Doctor, We don't have that much money left. We are already buried in debt. And we owe our relatives about $100,000.
We can try a conventional open surgical repair. It costs about $5,000 to $10,000.
Really? Thank you. If my father really doesn't make it, I won't blame your hospital.
I'm a doctor.
I can't compare to his ethics.
Xiao Li, take the family members back to rest first. We'll discuss other options.
Understood.
Chu, do you know what you're doing? This is a joke.
President, I'm sure of it.
Even the steadiest doctor's hand can't match a robot. Moreover, the patient's current physical state is terrible. He needs the Da Vinci surgeries. Quick healing and recovery advantages just to survive. By doing this, you're taking all the surgical risks on yourself.
It's fine, President. Trust me, I'm confident.
At this level of surgery, you can't do it. No one will guarantee for you.
Then I'll figure something out myself.
Hey,
Director Wang.
kid. What surgery are you doing now?
I want to do a tracheoesophageal fistula repair.
What? That's a level 4 surgery. Did you wholesale a bunch of level 4 surgery just to show off your skills? At my hospital? Fine. Go ahead. Notify me of the surgery time, and I'll come watch.
Thank you, Director Wang. Prepare for surgery.
Wang Ping is crazy to guarantee this kid for a level 4 surgery. It's insane.
Who let you in? This is a level 4 surgery. You wouldn't understand it anyway. So why are you here?
My peers weren't lying. This mentor really is fierce. It's just that I happen to be following Mr. Shu. I'm sorry.
I asked her to come.
Wait, what? So you're Dr. Shu's student? Well, that's different. It's good for young people to see more. It'll help them improve faster later on.
Exactly. Dr. Shu really is a responsible mentor.
Let's prepare for surgery.
The way he changed his tune was so fast. Still, Mr. Shu is so handsome and so respected.
Incredible. Truly incredible.
This is my future student. There are never any accidents during his surgeries. He's even shown us veterans. Something new today.
Send a copy of this surgical video to the neurosurgery department. I'll have my doctors watch it at least 100 times to show them what it means to be masterful and bold.
Doctor Shu, how is my father?
Relax. Dr. Shu is highly skilled, and the surgery was a success.
That's wonderful. Dr. Zhong, thank you for taking care of my father.
Take him for a laryngoscopy and another CT scan.
Laryngoscopy is fine, but no CT scan.
Why not?
It would leave a visual record. I made a major mistake, and in the end, I'll need Su Chu to clean up my mess.
Hype is just hype, but a resident performing a level 4 surgery? Is our surgical management system some kind of joke?
Exactly. For level 4 surgeries, you need at least 3 or 4 years of experience as an associate director. So Shu Chu can do it? I don't buy it.
Big Brother Zhang, I heard you also participated in that surgery. Tell us the truth. Is Shu Chu really as godlike as they say?
Big Brother Zhong was promoted to Associate Senior before turning 30 with a stack of research papers. He's a future Wang Shengde candidate. Who can beat him?
Everyone. I'm not even worthy of being compared to Dr. Shu.
There's a medical riot. Get ready for resuscitation. The OBGYN director Li Feng.
A patient didn't make it, and the patient's husband struck Director Li's heart.
Cardiac surgery. This is my domain.
Director Zheng. 3 fatal wounds. The right heart near the pulmonary artery, the right lung, and the left atrium. The blood loss is over. 2,000 milliliters.
The bleeding. I can't stop it.
Director Zheng, prepare to let go. I'll take over.
Chu. It's no use. Tell my husband and child that I love them dearly.
What are you waiting for? Let go.
What? What are you doing? With your bare hands? The blood. It stopped. His fingers are clearly blocking the pulmonary artery, the left atrium, the left ventricle, and various tiny bleeders. Is this truly humanly possible to stop bleeding like this?
Hurry up. An hour at most. No time for hesitation.
How is this possible? 3 cardiac wounds. How could they be finished within an hour?
Director Zheng, let me do it.
You? Are you kidding me?
Director Zheng, if you keep hesitating, Director Li will be too far gone to save.
I was actually intimidated by him.
Old Zheng. Let him have it. Maybe he can really do it.
What perfect mattress sutures? Finished in the blink of an eye. Is this the legendary Dr. Shu?
Check it.
Inside the heart, there's still a hidden bleeder. Blood pressure's dropping fast.
Continue fluids and transfusions. Add 400 milliliters of plasma, methylprednisolone, mannitol, furosemide, and sodium bicarbonate. Surgery complete.
41 minutes.
41 minutes. A surgery estimated at 3.5 hours, finished in just 41 minutes. He's like a machine. Dr. Shu, won't you truly consider switching departments?
Since you mentioned that, I have something to say too. Neurosurgery will always welcome Dr. Sue.
So will respiratory surgery.
Director Zheng, was the surgery a success?
Didn't you see? The star of the show right now is Dr. Shu.
Dr. Shu, you're a god.
Director Li, isn't that a bit much? I was just doing my job.
Congratulations. You have completed a cardiac rupture repair. Grade A+. 35 experience points added. Congratulations. 20 draws completed. 1 new function unlocked. Linhai Hospital Rank 1. Linhai City Rank 1. Baiyun Province Rank 1. Daxia Country Rank 7. Global Ranking 213.
The system can unlock new functions? A ranking system. Looks like I need to schedule more surgical practice right away. Chief Physician, was the surgery successful? Are they out of danger?
It wasn't me. It was Dr. Shu here.
Dr. Shu! Chief Physician, is the patient out of danger now? The surgery was a success. They've been moved to the ICU.
Dr. Shu,
Regarding this medical dispute that has caused a massive social impact, what is your opinion?
With a blade, repairing a heart is easy. But when it's a human heart that's cut, restoring the trust between doctor and patient is not so simple. How much longer until he's moved to a general ward?
Director Lee's recovery speed is truly unexpected. We can remove the tubes tonight. By tomorrow morning, he can be moved to a general ward.
That's still a bit slow.
What's with this disappointed tone? Removing tubes within 24 hours is already an incredible speed for recovery. He actually thinks his surgery wasn't good enough.
Before the attacker was caught, he kept shouting about blood for blood. The chance that Director Lee ruined the patient's life is very slim. What is the truth? Dr. Lee, it's me, Shu Chu. I want to ask, what is the situation regarding Director Lee's case?
Dr. Shu, why don't you come to obstetrics and see for yourself?
The patient's body is still there.
What body? That man's girlfriend is still alive.
Fine. I'm coming right over.
The patient and the attacker were pregnant out of wedlock. She already had heart failure, along with severe gestational hypertension. We warned the family that she couldn't get pregnant, otherwise mother and baby would both likely be gone. But they didn't listen, and let her get pregnant anyway. Once they knew an early birth was possible, they forced an abortion at 21 weeks. There has only ever been one successful case worldwide. It came out, and it was a lost baby.
I thought he was a hopeless romantic. But that doesn't seem to be the case.
She's such a poor soul. Given her condition, without the ICU, she won't last long. Since she lost the baby, her family abandoned her. When they showed up again, they were carrying knives. Her outlook isn't good now. Her hospital bill is over $10,000 in debt. Furthermore, her heart failure after she stopped the pregnancy has only worsened. The lung infection is also uncontrollable. I'm afraid she won't survive for many more days.
Wait. Why is her right lung slightly smaller?
The infection is severe, plus she has lung collapse. Maybe it's just fate.
She has a strong will to live. Try to contact her parents.
I heard that after she learned she was adopted, she ran away and found this man she met online. She chose him.
Parents are parents after all.
It's Dr. Shu again. I often see him practicing in the operating room. He works so hard.
No wonder Dr. Shu is so skilled at surgery. It's all the result of his hard work every night.
Dr. Shu at night is absolutely intense.
You finished one practice. Heart rupture repair proficiency. Increased by 0.5%. Your ranking has updated. Master level heart rupture repair. Ranked first at Linhai Hospital. Linhai City is third. Bayun Province is 16th. Daxia Country is 132. Global rank over 1,000.
An increase of 0.5. Pushed my provincial rank into the top 3.
National rank. Went up over a dozen spots.
Second day. Let's check in first.
Congratulations. You checked in at Linhai Hospital. Your impact factor is 5.9, granting you a medium tier boost. Rewards multiplied by 5.9. You received Master Level Heart Artificial Vascular Grafting.
Coronary artery narrowing. Scimitar syndrome. Why did she come to mind? Did I miss something about Miao Yue? The disease. Scimitar syndrome? It wasn't the pregnancy causing her heart failure. It was scimitar syndrome.
Dr. Xu, are you saying Miao Yue has scimitar syndrome?
Yes.
Based on what you've said, if Miao Yue truly has scimitar syndrome, then all her symptoms would make perfect sense. Unfortunately, the imaging isn't quite typical.
Dextrocardia isn't always present. Order a cardiac catheterization and an angiogram. As long as there's an ectopic vessel, we can confirm it. Have we contacted the family?
Last night, I talked to Miao Yue. She gave me her adoptive parents' contact information. I've reached out to them. They should be here by tonight.
Any other concerns?
I'm wondering, once confirmed, if it's really good news for the patient and her family.
Why do you say that?
You know Miao Yue's condition well. She is hanging by a thread. Once confirmed, a single surgery could save her life. But her physical state makes surgery almost impossible. This kind of agony might be worse than being beyond help. Dr. Xu, can't you perform any surgery? I wonder if you've found a solution this time.
It's Sunday. I'm going home to rest.
I knew it. Dr. Xu is only human. It's impossible to handle every surgery.
It doesn't matter. For this surgery, I will be the lead surgeon.
Dr. Xu, you're a lifesaver.
Come in.
Dr. Xu, Miao Yue's parents are here. They've consented to the surgery. All day yesterday, we were stabilizing the patient's condition. At the earliest, we can operate tonight.
Miao Yue is too weak. She won't survive another trauma. Prepare the artificial vessels in advance.
Got it. Dr. Xu, with you on this surgery, her chances of surviving just skyrocketed.
Shoot you. Your judgment was wrong this time. This surgery cannot be done.
It can't be done? Why not?
The cardiac catheter and imaging did confirm pulmonary vein shunting and confirm the scimitar syndrome diagnosis, but while we were performing further tests, we found the pulmonary veins diameter is only about 5 millimeters. Small vessels have always been a major challenge in cardiac intervention, and we never expected the patient's pulmonary vein to be this shrunken. So this surgery cannot be done.
I know that. What I'm planning to do is a small vessel replacement.
You anticipated this?
Correct.
So from the start, you were planning on a small vessel replacement?
Yes.
But this is a small vessel replacement. No one in Linhai Hospital can do that. How can Shu Chu say that with such a straight face? I really can't figure him out. His mental composure is terrifyingly strong. Fine. I'll authorize this surgery. But the procedure must be recorded, and you must allow the cardiac surgery and interventional doctors to observe the entire session.
Fine with me.
Dr. Xu, thank you.
Get some good sleep. Everything will be better when you wake up.
Okay.
Anesthesia is complete.
Begin the surgery. What are you looking at me for?
Director Zhang, didn't you say the chest opening step requires at least 3 or 4 rolls of gauze? So why hasn't Dr. Zhu even finished using one?
You're just not on the same level as Shu Chu.
Congratulations on completing a scimitar syndrome small vessel replacement surgery. Rating S. Proficiency increased by 1%. There is a reward pending. Claim reward.
Claim.
Claim successful. Obtained 1 high-grade energy elixir. It will maintain you in a full energy state and permanently slightly increase your energy limit. Effects last for 3 days.
No need for sleep. No need for rest. As long as I have physical strength, I can work forever. This is a great thing. Wait, doesn't that make me a workhorse? Director Wang.
Just finished surgery? Come to my office.
Okay. Director.
Come in. Sit down. Choo-choo. I assume you don't have much in terms of scientific research results yet?
No.
Perfect. Director Zheng has several research topics with great prospects, which can produce many high-quality papers. I suggest you give it a try and get used to the paper format.
Okay.
Once you're finished, show me anytime. I'll guide you myself.
Director Wang thinks highly of you. Treasure this chance.
Don't feel pressured. If that doesn't work, I have a few topics too. They will definitely get results.
Pressure? Not an issue. I have too many papers to write. I'll choose bone reconstruction. The data is more complete. It's highly difficult and very valuable.
Choo-choo, you must take care of yourself. I heard you've been awake for 48 hours. Go home now. I'll give you 2 days off. Get some good rest. Do you hear me? Your state of mind doesn't look like someone who hasn't slept for 48 hours. I'm starting to wonder if the other doctors are just exaggerating.
Director, I'm finished.
What? I wanted you to practice, but you must take it seriously. What can you write in 2 days? The title is written decently. The keywords, abstract, and format are all standard. Finished reading. For such a word count, the flow is surprisingly smooth.
Director.
Wait, just a second. Let me see again. You wrote this?
Yes.
A month after the surgery ended, you wrote a paper like this?
In 2 days?
What 2 days? 2 days of revising is perfectly normal. Some papers take weeks to revise.
No, I wrote it in 2 days.
A true genius. This quality is amazing. Unless it's a top-tier journal, if they reject it, they must be blind. Let's submit it directly to Daxia Trauma Orthopedics.
Fine. President.
Are you planning to get a perfect score? These are all data points that haven't been tested in 30 years, yet you're memorizing everything. Su Chu isn't joking. He really wants a perfect score. That is absolutely impossible. Since the Western medicine post-grad exams began, Daxia has never had anyone achieve a perfect score. Although Shu Chu is a skilled surgeon, there shouldn't be any surprises. Your score is the least of my worries, but for that competition, our hospital gave the slot to you. The minimum number for a team is 4 people. Should I help you fill out the team?
President, before I clock out, I'll send you the list.
You already have candidates?
Pretty much.
All right. I'll wait for the good news.
Okay.
Regarding this competition, don't be too hard on yourself for a ranking. Your advantage is that you're only 24. You'll have 2 more chances to compete. This time, just get used to the process. You can fight for rank later. As young people say, this competition is a battle of the gods. All the contestants are geniuses. All right. I'll be going now.
President, take care. Is anyone going from famous sword medical competition? I'm leading the team.
Famous sword medical competition is the elite physician competition, hosted by Daxia Country. Oh my god, one of us is actually participating.
Have you all forgotten? The hospital gave the right to select members to Dr. Shu. He chooses whoever he wants.
In previous years, famous sword medical competition required a brutal selection process. Is it this casual this year?
Brother Shu, Can I tag along just for the experience?
Sure. Brother Shu, me too. Okay. I'm so frustrated. I just turned 31 this year. If Dr. Shu had arrived a few years earlier, I could have improved my resume too. Done. Li Shui from OBGYN. Yun Mei from the ER. Attending physician Wang Fan. Urologies. Qin Quian. Capitobiliary surgeries Yan Na. Nurses. Liu Susu and Yang Meng.
What is this? Where is Zhang Wen? What about Shen Shanyu? How is it that not one genius under 30 is on this list? Besides Li Shui and Yun Mei, the rest are just here to make up the numbers. And why are there so many? Female doctors? What is this? Are they trying to organize some kind of girlfriend's trip? This Shu Chu is making this a total joke.
Director, were you looking for me?
Just look at this. The ones Shu Chu is taking to the contest. Who on earth are they?
Is our hospital hosting a beauty pageant? How did Wang Fan get in there?
This is for the contest. The contestants for the Great Surgeons competition.
I can accept Li Shui and Yun Mei, but what are Qin Quian and Yan Na doing there? With their skills, they are completely unfit for the competition.
What do you suggest then? Shu Chu is just too arrogant. Does he actually believe he can handle all the surgeries by himself?
What else can we do? It's just how geniuses are. Their pride knows no bounds. Since you want to mentor him, let him have it his way.
Let him have his way?
That's right. If he fails this competition, it might not be a bad thing for him. Let him learn there's always someone better, and he isn't the best. Only then can Shu Chu truly go far.
The price is too high. A competition held every 3 years, just to temper his arrogance.
Then take him off and let Zhang Wen lead the team instead.
That won't work. If Zhang Wen and his team go, how can they possibly compete with those freaks from Union and West China hospitals? There's no way they'd get a good ranking.
Isn't that the point? Without Shu Chu, given our hospital's current level, we'd at most place in the South Regional rankings. We'd never qualify for the finals. Director, it's been years since we finally found such a genius. Let him do as he pleases. Once he matures, a competition like this will be an absolute breeze for him.
Tell Shu Chu to prepare well and treat it as a trial run. The 2 competitions after this one will be his true stage.
All right.
Congratulations. You have mastered infratemporal fossa flip and zygomaticofacial composite flap surgery. Congratulations. You have mastered transnasal H incision surgery. Congratulations. You have mastered living donor nephrectomy and master-level renal tumor enucleation. Congratulations. You have mastered pulmonary embolectomy.
I heard over at Xiang Province, there are several hospitals this year, led by genius doctors. Maybe Xiangya won't even get a qualifying spot for Xiang Province.
Union Hospital side is the real battleground. The teams that make it out of there are the true warriors.
What kind of team is this? Why are they all women? The Linhai Hospital team, are they just for show? How is it that the captain's seat is still empty?
Where's their captain? For such an important competition, they wouldn't be so scared they're hiding in the bathroom, would they?
Li Shui. I remember in the last Great Blade competition, I was a member, and you were a member too. This time I'm the captain, but you're still just a member. Where's your captain?
Just finished the grad entrance exam, so he's still on his way.
You've got to be kidding me. Did your hospital's previous captain, Zhang Wen, not come? What a waste. Like me, this year. Should be his last competition before turning 30. Wait, the guy you said was taking the exam? It couldn't be Zhang Wen, could it? Well, no matter. In your hospital, only Zhang Wen's medical skills are worth comparing to mine.
Dr. Shu, you're here. How was the exam? With your skills, Dr. Shu, a simple grad exam is definitely no problem.
Is Linhai Hospital out of people? They sent a college student.
In a way, the lineup for Linhai Hospital this year is the strongest. That is, the strongest in terms of looks. Look, the men are handsome, the women are beautiful. Are they planning to ride someone's coattails into the finals, steal a spot, and fake their way to a title?
Linhai, a team of pretty faces, but that one named Yunmei is gorgeous. She's not bad. Doesn't our hospital still have a few openings? Wait a bit, we can recruit her.
I like that nurse, with the pear-shaped figure.
Let's just do our best. And let them say whatever they want.
If we get a urology patient, I'll be the lead surgeon, and I'll show those people what's what.
Leave the hepatobiliary surgeries to me.
I'll handle all surgeries on humans.
Oh my god! Doesn't that mean taking on every single surgery?
Did you hear that? Did you all hear that? Our Dr. Shu right now is an all-around expert in the ER. From brain tumors down to reproductive deformities, he can do it all. I'm already prepared to cheer for you. As for you guys, just wait to relax and let him carry the team.
In first place, Linhai Hospital, a perfect score. In second place, Jinghai Fourth People's Hospital, 85 points. In third place.
Am I hearing this right? The requirements: brand identity, anatomy, diagnosis, and surgery. All these combined, and not a single point was deducted. If Linhai Hospital is just a showpiece team, then what are we?
I heard after the match that post-grad student Shu Chu led the way, and they aced every single category. Simply incredible.
Shu Chu? That name sounds familiar. Isn't that the star doctor from Linhai Hospital,
Looking at it that way, getting a perfect score is no surprise for their team.
Dr. Shu, outside his province, you'll face hospitals like West China Hospital and Union Hospital. You should organize a team with no weaknesses. As for me, I specialize in heart surgery. I'm applying to join your team.
I'm from the urology department, and I'm likely stronger than the female doctor in your group. I'll take her place.
I've performed liver cancer resections, and furthermore, I've assisted in critical cases and acute pancreatitis surgeries. Out of 4 patients, I saved 2. I must be more capable than Yan Na on your team.
You should bolster the lineup. Otherwise, your team won't have a fighting chance in the national finals.
Right.
It seems everyone recognizes Dr. Shu's talent. Let's wait and see who he chooses to recruit.
Dr. Shu, Nana and I can both step down. This competition only happens every 3 years. Since it's your first time, you should aim for the best results possible.
We'll be waiting for your good news.
I'll step down too then.
Why should anyone step down? We are a team, and we are going to the nationals together.
What do you mean? No reorganization? Shu-Chu, you're being far too arrogant. The nationals is not a place to show off your individual skills. If the team has any weak link, everyone will be eliminated. Su-Chu, Captain Shu, we can all join your team, Linhai Hospital.
Let's head back. We're going to the nationals.
You. Why you?
Dr. Shu, it's so reliable and cool. Wait for me, Dr. Shu.
Why are you still calling him Dr. Shu? Call him Captain Shu. Here we come.
Today is the celebration for Dr. Shu's exam and the distinguished scalpel competition. As long as it doesn't affect tomorrow's work schedule, feel free to have a drink.
Director, we shouldn't call him Dr. Shu anymore. We should call him Director Shu now.
Xiao Su, he is truly a medical miracle. After just 18 months, he's already been promoted to Deputy Director of Emergency. His published papers and research projects are too many to count. Not to mention how many medical miracles he has performed. Shu-Chu, do you have other plans for the future?
Director, I still want to continue working in the ER. And after that, I want to research the brainstem, spinal cord, and the liver S7 fields. After being promoted early, the system's mystery reward was indeed brainstem surgery. In the past year, my surgical rankings have risen to #1 in the country and top 3 in the world. It's time to tackle those restricted zones.
But those are all no-go zones. In this country, those who can do them can be counted on one hand.
If anyone else said this, I would think they were being incredibly arrogant. But since it's Director Shu, I believe the future, medical level of Daxia, will lead the world by 20 years.
Vice President Wang is absolutely right. Dr. Shu is practically unbeatable in medicine. Whatever he says, he makes it happen.
Good. Very good. At this rate, within a few years, I'll be giving up my seat as Deputy Director to Director Shu. Still, as your teacher, I'm very proud.
All right. Let's have Shu-Chu say a few words.
To everyone who supported me, I truly thank you for looking out for me. Learning is vast, and medicine is infinite. In the future, I'll keep working hard in all fields to help even more patients.
Come on, cheers everyone. Bottoms up.
Please, take a seat.
Dr. Shu is basically a national treasure. There's no surgery he can't do.
A true physician must have a heart for the world, treating patients as kin, ignoring wealth and exhaustion, fully devoted to saving lives. That is what defines a true master of medicine.